is John Mayo, and I'm the Deputy Executive Director of Successful Kids and Families. I'm also a licensed mental health counselor for about 30 years now, and am the parent of two adult children now that have special needs as far as emotional behavioral issues and addiction. So I kind of wear a lot of hats here, and a lot of those life experiences and stuff kind of give you a unique perception on life. And one of the things I like to do is for everybody to go around the room and introduce themselves as to why you're here and what you think you may get out of it. And then talk about a strength that you have that you believe will be helpful in this endeavor that you're going to start as far as a journey with our agency. And as I kind of started alluding to, one of my strengths is what I said, is that I've got a lot of very personal and professional experience that's really given me a unique kind of way of looking at things. And I learned a lot from the families that I served as therapist, and from my role as a dad, probably more than I did in graduate school and since then. So, Marcia.
Thank you. Good morning. I'm Marcia Lang, and I'm also a licensed mental health counselor. And I have been here along with John and a few other people since the inception of our agency, which has grown and evolved to a very different place than we started. But I don't think we've grown and evolved at all in a different place from the philosophies that we had when we started it, and we've always tried to keep that, and that's what you'll be hearing a lot about today also. So I am a parent and a grandparent. In fact, I will soon be a busy grandparent because his parents are away this weekend. His grandfather will be busy pretty much this morning, and then later I will. But anyway, it's really a pleasure to have you all here, and so many new faces and so many not so new faces, but looking forward to doing some of the work that we do here with us. And I guess the strength would be, well, I started to say curiosity and like and learn things, but I would say maybe I'll choose tenacity, which is kind of sticking with something no matter what the challenge is, and kind of finding ways around them and ways of working with other people to have a different perspective about how to go about things in a different way, and not look at it as a way to help us stop on something, but just a way to regroup and decide which other direction maybe to take or which approach to take. So again, it's really a pleasure to have you here and see all you here. Thank you.
Okay. My name is Beth Goldbright, and I'm a master's level social worker. I've got maybe 17 years of experience here in Hillsborough County working with children and families, and I think that's one of the strengths that I bring to the table. What else did you want to hear about? I'm a mother of a teenager, so sometimes I feel like I'm pulling my hair out because he definitely is now a new creature. And I also feel that because I'm a single parent, I'm divorced, I can identify quite a bit with some of the struggles that our parents have, you know, trying to juggle all the balls and do it themselves. So, and then the last thing is that I really, because of my experience, I believe in the resilience of families.
And she's a great worker in the court system, so.
Oh yeah, I work with the courts, I'm sorry, with Judge Ralph Stoddard with the crossover cases, and that's for children that are in the foster care protective services department that pick up law violations. And so we try to make sure that we look at the needs of the child before we try to give them punitive consequences for these crimes. We want to make sure that their needs are being met and addressed.
But why are you here today, though? Because you got another role.
Oh yes, I'm here today because I'm actually working towards my licensure. So Claire Reynolds is my qualified supervisor. Again, I have my master's from Florida State University, and I'm doing my postgraduate hours with Mr. John Mayo at the detention center. I'm not sure if you guys are familiar with this new proactive program. Anybody? No? Okay, there's a program at the detention center. Got kids that are a captive audience. They're there for 21 days usually maximum, and we're working with the youth and their parent, or in some instances, a grandparent, whoever a concerned caregiver is, and we're implementing the brief solution-focused therapeutic intervention with these clients. And so far, so good. It's been about 3 weeks, perhaps.
Brand new.
Yeah, brand new program, so I'm very excited to be a part of the Success for Kids and Families family. Thank you.
I'm Tia Gaffney. I'm a master's level social worker. I have a background in child welfare, but now I work in the Hillsborough County Public School System as a school social worker, 2 schools in Dover. And I guess one of my strengths is I'm compassionate and I like helping families find solutions to whatever crisis and problems they're going through. And I really miss case management, so.
And you're gonna be,
Oh, and I'm gonna be a mom. I'm expecting in April.
that's an important.
Hi, I'm Wanda Caballero. I just finished my master's degree this past June in guidance. So I'm so glad to be here because I know I can learn a lot from all of you. And I would say that one of my strengths is like I like to help people because I came from a family that I'm so thankful that I have people who helped me to be here today. So that's why I want to return that to family. And I have 2 girls. One is going to be, one is a senior. She's going to USIF. So I'm very proud of her. And one is 12 years old. It's nice to be here, guys.
I'm Colleen Davis. I'm also a master's level therapist, actually mental health. Been in the field, I guess, since '04. I have 3 kids, 3 teenagers. God help me with you too, right? I understand the hair thing. I'm here because John told me I had to be. Because I'm now staying, fortunately, with Success for Kids and Families since our program closure recently as an intake specialist. So need to kind of add this to my repertoire of training certificates and such. And very glad to be here, great group of people to work with, very fortunate. And I guess one of my strengths, I like to put people at ease. We deal with a great deal of people that are very uncomfortable, don't necessarily want us there, sometimes embarrassed, sometimes feeling judged, that sort of thing. I try to use humor and, being able to relate to them, to put them at ease pretty much initially so that we were able to go forward and utilize their strengths to help them do what they need to do to accomplish their goals for their family. So,
Sure,
that's it.
I'm Ally Talenti. I'm a master's level mental health counselor. Worked with Colleen and everybody during the Successful Families program here, which unfortunately I know closed. So I am now working in a residential juvenile justice program, which is where I kind of came from before I came here. So I kind of went back to what I've been doing for a long time, high risk over in Manatee County as a mental health counselor there. Been doing this for several years. Strength, well, I have no children, but I do have a child that's of the canine persuasion, and he's got no hair. He's hairless, yeah.
On purpose?
So it's kind of like a little baby. Yeah, on purpose.
Oh, okay.
Yeah, he's beautiful. I'll show you pictures later. I'm very proud of him. Strength-wise, I'd probably say, as I've learned more recently, I'm very adaptive. I can really maneuver into different situations. I'm kind of a social chameleon anyway, and I do think that helps particularly when you go out to different families. I can kind of maneuver through different cultures and change and handle challenges pretty well when they're thrown at me. And I think that helps me understand and hopefully get our families to be adaptive that we work with.
My name is Colbert Spencer. I'm a master's level mental health counselor. I'm also a registered intern. I'll be retaking my licensure examination next month. I'm also a certified addiction professional. Been working with kids and families in Hillsborough County for quite a while now. Strength-wise, I think I'll go with creativity or being creative. A lot of the families we work with, they're really the masters of their domain, but sometimes we all have difficulties trying to see through the cloud. So what I try to bring to the table is different way of looking at things, helping them to see things different, stepping outside the box if you want to look at it, and let them come up with the solution to their own situation. I'm a parent, a grandparent, have one grandchild, spoiler or rotten.
Oh.
Yeah, her parents gotta clean that up.
She spent the last 2 weeks with you, I understand?
Last week,
Last week,
yeah.
okay.
That would
Now the next
include
2
an
weeks is
extra
mine to regroup from that. And I've been working with Success for Kids and Families since January of last year with a program that ended last month. But I've been involved with Success for Kids and Families, and previously when it was Think Kids, to other collaborative efforts in the community. And so the work that we do, which is very vital in this area, needs to be continued, and so that's one of the reasons why I'm here working as a contract case manager. You're up, Ty.
My name is Ty Baldwin. I'm a master's level social worker. Worked for Successful Families for last year. I just recently transitioned over to Gulf Coast Jewish Sitters stationed in Pinellas County. It's also a diversion program that is aimed at keeping families safe at home is the name of the project. I think one of my strengths would be the ability to engage families.
I'm Lynn Cassidy. I have a varied background. I was a marketing rep with IBM. Then I left and we adopted a sibling group of 4 brothers who've been in 45 foster homes.
Oh my gosh.
And the experience at IBM really taught me to learn how to fight for resources. The boys really taught me mental health issues. I used to joke that I didn't work those years because in any given week we had 5 mental health appointments and none of them were mine. Right, John?
Yeah, pretty much.
And then the last 7 years I've been working with the Administrative Services Organization, both independent of the Children's Board and then when it was brought in-house. So there's strengths there in understanding what case managers have needed. I guess what I'm hoping to get out of it is what I saw in the ASO is case managers struggling to how to say no, because we can't open it all up anymore, and that's a piece I really want to get my arms around, because I'll get pulled in with compassion.
Good morning, I'm Beth Pecora. I'm the family specialist here at Success for Kids and Families. I have degrees in advertising, communication, and elementary education, and I'm a certified recovery peer specialist. But I come to this work because of my own daughter, who was diagnosed at the age of 3 as what's called a selective mute, and happened to be working in the community when the Children's Board decided to write the federal grant that brought all this together. So I was very blessed to help write that $7 million federal grant and then get hired by the Children's Board. So it brings me great pride to see all you people around the table still continuing the work we started many, many years ago. So yeah, so it's kind of like, wow. So I worked for the Children's Board for about 7 years as their family involvement coordinator. Then went out into the community and did some independent work, and Clara brought me around and in-house and let me work with John and stuff. So here I bring the family's perspective to the work that we do, always making sure we think from what the family is going through. I do training with John, I write curriculum, I don't know what else I do. Research, CSST, which is the residential piece. I work with the families to help them get their children in residential. I do our COA accreditation, you name it, whatever they want me to do, I do.
Jack of all trades.
Yeah, so anyway, so I love working here and I love working with you guys because you guys are avenues to the family, and I would love to have had any one of you when my children were going through this. It didn't exist, so I would have been blessed to have any one of you to help us with that. I have 2 children. My oldest is 25. He's working on his doctorate of psychology at FIT. And my youngest one, who was my child that brought me really into all this work, is now at the University of Florida working on her veterinarian degree. So I'm very excited that they both have become successful. They both dealt with mental health problems and continue, but they're good advocates for themselves and stuff. So I'm just blessed to be here. So.
And good morning.
Good.
We basically introducing ourselves with like our name and kind of why we're here, that kind of stuff, and then the strengths that we have. So, I mean, if you could, like, on the fly do that, that may.
Well, first of all, excuse me for being late. I had a little car problem and the door was locked downstairs, so I couldn't get in. My name is Cynthia Cruz. Currently, I work as a health educator for health insurance. Work at home. Kind of comfortable because I did case management prior to that. You were a case manager, which I recognize some faces from prior jobs. I did DV. I worked as a domestic violence intake. I've had quite a variety. I taught in New York, so I was a teacher in New York for 3 years. So I've had a little bit of, so I've been around children quite a while. And as you said also, I wish when I was raising my children, I would have had all the networking that they have now and all the supports in place. Like I know from prior experience, because I was a resource specialist at the sheriff's office, and I know we linked them with a lot of agencies to keep the family together, which is important because years ago, I mean, my niece was my foster child. They were pulling children apart. I mean, they weren't even thinking about, I mean, when they took her into care, they just took her into care. They didn't even bother coming to the family and asking, what can we do? So I think if a lot of the services would have been available then, I think life would have been much easier. I have a 29-year-old daughter, I have a 24-year-old son, and I have a 9-year-old grandchild. My son just graduated from USF from the architecture program, so I'm happy about that. My daughter, like we said, we always have two different children. My daughter works for building and coding, but she hasn't quite found it yet, but we're working on it. My strengths are, I guess, patience. I mean, since you've come, I came from New York, I did have a foster child, which was a relative. It's even harder when the foster child's a relative because there's like boundary. It's like, you're my aunt, you're gonna tell me what to do. And they still use the same words that the family still goes through the hardship of trying to put them together again, and they're still broken. I mean, the person's still an adult and they still have issues that were never met when they were a child. Even up to recently, I was talking with her and she's like, we're going through these conversations and I'm like, Lord, thank you, I'm gonna work with families again because she's an adult and we're still going through stuff that wasn't dealt with when she was a child. So I think patience and having some experience from knowing where these families and children are coming from.
Very good. Mike?
Yes. Morning. My name is Michael Parks. I just joined the organization about 2 weeks ago as director of HR. Wanted to sit in today to try to get a flavor for what this training is about and meet some more people and try to learn more about the profession. The one thing that struck me on my background, it's kind of been full circle because I was actually a special ed teacher for Hillsborough County back in the 80s. Left that and went into business. But what I've already been struck by is the level of professionalism that I've seen change since 1980 when I was a teacher in Hillsborough County school system. Then everybody did it because they wanted to give back to the community. And it really wasn't the degree of professionalism and knowledge that I clearly see already today. So I'm excited to come full circle and be back. As far as my strengths, I've always been told that I'm good at balancing the needs of the organization and the employees so that there's a fair balance there, right? So that the organization is able to meet its goals and objectives and the employees are treated fairly. So I would consider that probably my top strength. So thanks for letting me sit in this morning. I appreciate the opportunity.
And his strength is kind of like how come we hired him. Kathy?
My name is Kathy Fabry. I'm the clinical supervisor here at Success for Kids and Families. I'll be here, it'll be 2 years at the end of this month. I have a lot of experience. I've been doing this for 34 years. I know I don't look that old, but I started when I was 10. But, I've worked juvenile justice, I've worked mental health, I've worked child welfare, up north. I worked in the adult system, juvenile system, so, I enjoy what I'm doing. I love supervising contractors. I have a great team. We provide some great services for this community. I truly believe with the need out there, I think we can provide more. The strengths I think I bring is, there's a couple. One is the experience that I have in the types of populations that I've worked with. The other is I tell everybody, I was born a social worker, not made. I am a licensed clinical social worker, but it isn't the degree in the education that gives me the knowledge. It's what I did and who I worked with. And I truly believe I'm good with these kids. It's because I was one of these kids when I was younger. But back in those days, in the 60s, they didn't, you had two classes. Either you were in regular classes or you were in what kids call boom boom classes, They didn't call parents and say, we want to test your child because maybe it's just a learning disability. They just threw you in, parents accepted that. So I think some of my skills came from, I went to school with those kids. I was in those classes, So I learned a lot of different skills, how to communicate with people, how to, that being in those classes doesn't necessarily make you a certain kind of person, and it also gives you strength. It gives you resilience to say, listen, I don't have to accept what people say. I can be what I want.
So basically, for some of you, this is going to be, a review for our staff that is joining us today. For the rest of you, this may be kind of new, so we'll go through it pretty quickly. But basically, one of the philosophies that we have here at Success for Kids and Families is a consumer-directed care model. And I think it's important for you to know that we are truly the only consumer-directed care model for children in the state of Florida and in the country that we know of, where we look specifically at the needs of our families and truly look at the individuality of all of our children. And so this is the definition we crafted. It means that children with a serious emotional disturbance in their families choose the services and supports that they want. For those of you who worked with us, you've done this, you know that. For those of you that are new, we truly mean that. The families drive the process. You're there as a consultant with them to help them identify what they need and to put those needs into a workable plan so that they and their children can be successful in the community. You are that caring professional we talk about here that helps with that. And we do want to keep our children out of residential care, like I said, functioning in school, functioning in the YMCA, functioning at home with their families. Now, what is a system of care? The easiest way to say that is how a community takes care of its own. It's how we all get together, blending the resources that we have and wrapping around services and supports and bringing in those informal supports that a lot of us who are family members our kids have actually burned many of those bridges. A lot of the aunts, uncles, grandparents, friends are like, I'm not getting anywhere near that kid. They are done. I tried to babysit, I tried to help you, but those temper tantrums are sending me over the cliff. My dad's version was she just needed a good spanking. I'm like, no, I don't think so. So, but that's how we take care of our own. We also recognize in a system of care that our services don't meet categorical service models. And what I mean by that is not every child needs therapy. Not every child needs medication. For example, with Caitlin being 3 years old, a selective mute, afraid to go in the community, afraid to talk to people other than mom, dad, and her big brother, it meant horseback riding for the handicapped, where she was put on a horse and two strangers walked beside her to get her comfortable, get her used to being around people, while mom and dad did the therapy to help them understand this child and how to parent her better. We also respect each agency's societal mandates. Our children are involved in the court system, in DJJ, in the schools, that's where they spend most of their time. While we have our mandate of what we need to do to help get them mentally healthy and get them what they need, each of these agencies also need to protect the children and do what they need to do. And we don't blame or bash, we work together and we respect what they're going to do. Like DJJ, they've got to keep the community safe. So sometimes they have to put these kids away. We have to respect that, but figure out how we can work with them to get that child what they need. important. It's comprised of formal and informal stakeholders. Us as the professionals working with the family, but bringing, like I said, those informal supports back into a family's life, getting them connected to their churches, back with grandma, grandpa, aunties, and uncles, so that when we step out of the picture, the family has people that are there to be with them. Because I think Ty said it very well, that we don't want to be there with them forever. We can't handhold them and solve all their problems. We want to build them up, step out, and make sure they have the supports they need. And then success is closely linked to fiscal incentives. And I think that's true, you know, across the whole business world, is that we want to be successful, and the more successful we are in keeping kids out of residential and high-end placements and high-end services, the cheaper things are for the people that fund us, and they'll want to continue to fund us. Right? Okay. So I've covered the easier definitions, so I'm going to forget this slide, but you're welcome to read it in your free time. We put it up here because it was something that was developed by one of our board members, Dr. Bob Friedman, out of Florida Mental Health Institute, and we respect the work that he's done, and he still continues to guide us today. But like I said, it's how a community takes care of their own is basically the easiest way to say that. There are 3 core values that really drive the work that we do here and the work in a system of care. Family-driven and youth-guided. I mentioned the family drives it. Hopefully the more they'll participate in their own success and their own recovery. So we want them to pick the types and mix of services they're going to get. Community-based. We want everything to be based in the community. You'll see that most of our families never come to this office. We go to them. We want the child to be in their community, going to school on a regular basis, participating as other children do in their community. And we want the family to be able to live the lives that other families live. Lynn had a very good example. 5 mental health appointments in a week. You know, that makes for kind of chaos in a family's regular routine. How does that child enjoy the fun things that other children get to do if their mental health needs are all time consuming? So we really want to base everything in the community as close to the family and work on those schedules that families have that time to be involved in the community. And then everything needs to be culturally and linguistically competent with the agencies, with the families. And I love what Allie said earlier about how she's able to get in there and be a chameleon and really be able to look at the cultures of the families that she's serving, understand those cultures, and work within their culture to bring them the services and supports that they need. It's not just about language. It's just not about the color of our skin. Every family has their own individual culture.
And we'll be doing a fair amount of work with that, you know, over today and tomorrow too, as far as really kind of trying to make sure that you all come out of that with not only just kind of an intellectual concept of cultural competency, but really much, much deeper than that. Because that's the core, for the most part, of really the work that we do with our families.
And John has a great, fun, interactive exercise that we'll get to do. So, I'm not going to read all these guiding principles to you. I'm just going to highlight a few words in each of them. There have been 10, and they went to 13. Now they're back to 12, so that could very well change any day now too.
Well, and I'm completely convinced the reason why it went from 13 to 12 is because the 3 people that developed or enhanced and improved these things were like superstitious. So they like combined 2 into 1.
I think that's what it is too. So what we want to make sure is our families get a broad, flexible array of effective community-based services that support their emotional, social, and physical needs, and that are traditional and non-traditional, like I talked to you about earlier. Lynn mentioned the Administrative Services Organization that she used to work for, the Children's Board. That is our way of being able to do that, is working with those different providers. The ASO has providers from plumbers to psychiatrists that whatever a family needs, we can get in there and fix and give them so they can live in their homes, be successful, and minimize the chaos and stress they're going through.
And we'll talk a lot more about the ASO and also about the changes that have actually occurred within our child and family serving system as far as flexible funds is concerned, because there have been some pretty significant changes and unfortunately they have not necessarily been towards a positive kind of outcome, and we'll talk about those.
Bingo.
Bingo!
Already? Yes.
Yay, Colville! Pick a prize, any prize.
I'll take that laptop.
Yeah. sorry.
Where the
no.
prices at?
They're
All
right
the
in the
little
middle.
things that Kathy and
There's a
John have gathered throughout the many
screwdriver,
days.
there's a flashlight.
Clipboards.
And let me just iterate that this is a not-for-profit, and so the prizes basically have been gotten at the dollar store.
Hey, my favorite food.
All right, so number 2, it talks about individualized services. Like we said, we want these services individualized to the needs of the family. We deal with a strength-based wraparound planning process, and we'll be going more into depth on how to be strength-based. And that's one of the reasons John asked you to think about a strength today, is because you can't know your family's strengths if you can't find your own. So we'll work on some of those as well today to help get you used to that. We want services included to have evidence-based and be evidence-informed and promising practices. We'll cover some of those today as well. We always do everything in the least restrictive environment. Like I said, staying within the family's home, staying within the family's school and community, keeping that kid out of those deep-end placements. We want to make sure that other caregivers, the youth, and the families are all full partners in planning of everything. Like I said, you're the consultant. Family drives the process. Youth helps guide the process, and we want to bring those informal supports back into the picture. We want to make sure that everything's integrated at the service level. And this is where you guys come in, basically, helping the family to make connections, helping to make sure that the agencies are partnering together and that everybody's working on for the best sake of the family. Like with Lynn's family, 5 appointments in a week. Are those coordinated? Do each of the different service systems her children are dealing with know that she's got an appointment on this day so that the school doesn't want her here one day, whereas the psychiatrist wants her there at the same time? You get to help help her to coordinate all of that. Care manager, we want you to provide care management or similar mechanisms at the practice level to ensure that they're delivered in a coordinated and therapeutic manner. That's kind of repetitious.
It could be like 11.
Yeah, thanks. I can cut all this down really simple.
Yes, I know.
We want to make sure that there are appropriate mental health services and supports. Like I said, Katie as a 3-year-old being in therapy would not have solved the problem, okay? So we want to make sure that our children are getting what they need. Therapy, John will talk to you, is not a need. It's not what every child needs. Some kids need medication, other children do not. You've got to be open to different things and making sure that it's what that child is really going to be successful at, or what's going to help them to be successful. We want to make sure that we do good transition for our youth that are 18 and going into or 17 and going into the adult system. In our community, I'm going to say it stinks. We don't do a good job of that. Those youth are just kind of hanging out there. They don't fit in the adult system because they're not adults yet, but they don't fit in the children's system either. And so we really need to look at that as case managers when we're working with those youth. What can I do to get them connected? So I've got them stable now. How do I keep them stable? How do I get them the services they need? How do I educate them to be able to carry on and take care of their own mental health needs? Incorporate or link with mental health promotion, prevention, early identification, and intervention. That's key. We really oh good, take a prize. We need to get in as soon as we can. For some families, like with us, we were lucky. We got in when she was 3. It made a big difference. But for some families, they may not have the connections that I have. And as an agency and as case managers, it's important for us to help say, hey, have you thought about this? And the school district, you guys help families to see sometimes what they're not sure is happening. Is this regular childhood behavior or is this not? So we need to get in and intervene as early as possible to get the best outcomes we can. We always have continuous accountability and quality improvement mechanisms here at Success for Kids and Families. That's why you'll see a lot of the paperwork that you're going to have to do, which is the hard part of the job, if you ask me. The mental health outcome form, the MHO, the CFARs that you'll be learning to do, doing those outcomes. We have to do those. Bingo for you too. Good, grab a prize. We have to be able to account and show the people that are funding us that we are getting good outcomes for families. So we'll be asking you to be involved in research projects at times, but you will have other things for outcomes you'll have to complete as well.
Well, and what we do here for the most part is we have all the outcomes that the funders have, but we also add outcomes that are based on these values and principles, and also fidelity outcomes.
Oh goodness, this is starting way too early.
I've been having a lot of trouble with my voice lately. I've actually got a...
Usually we get through at least a day.
I know. But at any rate, we actually have outcome measures and fidelity measurements that some of you will be participating in because it's a random sampling type thing. And we'll talk a little bit about that as time goes on too. But we really try as much as possible to integrate the evidence-based practices, the fidelity of them, plus the regular work that in essence our funders expect for us.
We also protect the rights of children and their families, and we promote advocacy efforts. That one's pretty easy. And then last but not least, provide services and supports without regard to race, religion, national origin, all those different things. And we're sensitive and we're responsive to those needs of the families. It's Success for Kids and Families. Like I said, our families may have insurance private, they may not. They may have Medicaid. They may be immigrants. They may be people who are in this country illegally, but we are still going to do what we can do to help them. As far as how we work together for families and children. We don't just come to the table and want to do things the way my agency wants. People are more open to looking at how they can partner with each agency to help our families. And then impact. How have things changed? How have things improved? What do the outcomes look like?
And I think what's important here is that the implementation of these system of care values and principles, if the more they are followed, the better the outcomes are for our families. And that's been basically researched now ever since, I guess actually the 90s with longitudinal studies.
And I've seen it. I happen to be a federal site visitor for SAMHSA. So I get asked to travel to other communities that have had the dollars we've had to look at what they're doing. And I've seen how much better when we practice with the system of care philosophy, how much better the community becomes, and that ultimately makes our families and our children much more successful. Oh, John's favorite chart, so I'm gonna sit down. I don't like this one. So.
And I'll try to get through this.
I'll
like
help
that.
you.
Yeah, good, thanks. Yeah, I had the flu, even though I had the flu shot, I got the flu. I've been having trouble with my voice anyway.
Yeah.
And so.
But usually we get through one day of training before you get crazy.
I know, it's like this is not good. So system of care, SOC, you'll hear that a lot from us on a regular basis. And if you look at this, it's probably easier to see here than it is on the PowerPoint. This is kind of how it's broken down. As we talked about the value, the first is family and youth driven. Second domain or value is community based.
Bingo.
Excellent.
You know, I have to say that
It's very disruptive, isn't it?
no, that's fine and stuff. We actually are getting used to disruption because disruption isn't always is never actually that bad. But I've never seen anybody that so fast.
I have.
God, this is like I'm impressed. The second domain is again is cultural competency, and then we look very closely at the fact of like, are we making an impact? Do we change things or not? Because if we don't, no matter what all this fancy stuff is, if there's not really a change and an impact with our family and youth, then they're just words basically. So, and this by the way is somewhat teaching to the test because this is also the breakdown of one of our fidelity measurements, which I'll actually talk a little bit about and stuff I guess after, because I think we get to that point.
I think it's tomorrow.
Okay, good. If you really look at how like what are the parts of family and youth-driven care, it's important to individualize services. And when we talk about individualized services, and we chat too, by the way, it's like really what is it specifically about this one family? What is it specifically about the next family? And what their individual needs are, what their strengths are. And if you really are going to individualize planning and assistance with the family, you've really got to know them, and they've got to know you, and they've got to trust you. To talk about what things are specific to them.
Okay. It's a lot of what we just talked about. So yeah, for full participation is the family talking and participating and the youth guiding the process and saying what they believe in and bringing in their informal supports if they wish that to happen. And then providing that case management, like I said, where you are the consultant working with the family to help them create that family support plan that's going to help give them the roadmap to accomplish what they need to accomplish. Then we talked about community-based. And we looked at and we talked about how important early intervention is. The sooner we can get a child and family working to solve the issues that are going on, the better off that child is going to be. And the more successful that child is going to be. Then we need to make sure that access to services. Are there services in the community, but are they close to the family? If you live out in Plant Cities, a lot of times it's really hard to get what you need. Getting transportation to those services is hard to get what you need. So as a system of care, we need to make sure that those services are available and that families have good access to them. And if that's a problem, we need to figure out as a community how to solve that. Minimal restrictiveness, what do you mean by that one?
Well, the situation, and I'll use a school example. If a young man has, or a young lady has some attentional issues, and if they're in a very large class,
Oh, least restrictive.
you may see that's maybe great for everybody most of the time, but not this individual. So a smaller class, while that's not as in the least restrictive,
Right.
is still at the same time most appropriate. And so we try to find with our partners what is the best fit for the service versus the needs.
Okay.
So,
And then integration and coordination, making sure that the work that we're doing is done in an integrated fashion and it's coordinated based on what that family needs.
another thing about the restrictiveness is that it's really important to be able to plan as much as possible for normal kinds of behaviors, normal kinds of activities. Because the more normative a set of plans are, the much better a child and a youth and all are going to be able to stay in the community and also kind of get that experience that all of us humans really enjoy and benefit from.
For true. Culturally competent. Awareness is key. Not only being aware of the family's culture, but of your own culture. And like John said when he says teaching to the test, one of the things might come to you with a system of care practice review is ask you about your culture. And we're going to explore that today. You can't look and understand another family's culture if you don't even know what your culture is and how your family functions. Sensitivity and responsiveness, being sensitive to those cultures, being responsive to the needs of what those families need. Agency culture. And while a lot of us, because we work in the field, understand the different cultures of agencies, our families may not. So it is our role to help them understand how MHC Incorporated functions, how Success for Kids functions, and the schools especially. How do you go in? How do you react with them? How do you work with them? How do you talk to them? What time are they open? When can you call? When can you go? Helping families to know that is important so that then they can be their own advocates when you step out of the picture and go. I've found a lot of case managers will come and say, Beth, I can't get the family to go to their appointments at the mental health agency. And I'm like, well, have you maybe attempted to go with them once because maybe they're intimidated? Some parents are intimidated to walk through the school doors because they've had a nasty secretary. That doesn't happen in all of our schools, but that's happened before. What has happened in the past, we don't know, but sometimes taking that one step, accompanying them the first time, helping them to know, gets them over that hump and then they're able to do it for themselves. And working with their informal supports. Every culture, every family has their own informal support system, whether it's functioning or not functioning. And we need to help make sure it is functioning and that it is strong and that those informal supports are involved in everything we do. And you want to try improvement?
No,
Oh,
the
you-
informal supports, we're also talking about the types of informal things and services that are available to everybody. The park down the street, boys and girls clubs, the scouts, those types of things too, because it may be that families' informal supports may be part of our plan, but they may not be a part of our plan. It depends. Some families choose not to have their extended family as part of it. And so we're also talking about what's available in the community at large. And one of our responsibilities is to help families be able to determine what fits for them and what are available. And sometimes what supports might need to be put in place in order for that youth or that child to be part of the Boy Scouts or to be on the Rotary.
Right. And then impact, like John said, are we having improvement? Are our families getting better? Is our system improving where we're able to coordinate services better? And appropriateness. Are the services that the family is getting, are they appropriate for their needs and what they want? Or is it not going to do any good? They keep going and going and going and you see no improvement. Well, maybe that's not the key. We need to look in a different way, be more open-minded to something very different.
And I think what's also important about those two things is improvement. We have our outcomes with our funders and the types of things that we always look at, decreasing symptoms levels, those kinds of things. But also, what does the family and the child and the youth think as far as improvement? do they feel like they're making improvement, and what kinds of ways of measuring that or looking at that are real specific to them. And those for us are just as important as the Department of Children and Family outcomes also. And I think the other one with appropriateness is also what kinds of services and supports are appealing to the family and what are culturally matched and culturally appropriate. Things that I like and that my children like may have nothing to do with what the person next door, in fact, I know that's for a fact, likes and are appropriate and will benefit. And I guess it gets to the old thing, it's as if a child and a youth are doing something that is appealing to them and is proactive, it's really hard to be in trouble at the same time.
All right, let's see, you're recovering, let me see the agenda real quick, wrap around in this one? Yes, okay, cool. All right, so you, oh, good.
Yeah, I apologize for that, honestly. Viruses. When we talk about wraparound, we're not talking about like a certain set of services at all, because for those of us that have gray hair or may really have gray hair, but it's not gray, so look at and have been around the system for a while, wraparound really used to mean wraparound a certain specific set of services. Medicaid management, therapy, maybe a mentor, maybe a group, that kind of stuff, which was a great idea, and it was very popular basically in the 80s and the 90s when we were moving finally out of just only outpatient in an office. But today, basically, and what's happened is a kind of a morphing, I think, of this over the years. Wraparound is really a process. It's a process of being able to, in a very structured way, define the strengths, define the needs, find who basically can be of service and able to help the family meet their needs, and teaching the family and helping the family become independent. So, well, traditionally you might look, as far as case management is concerned, you might look at like, oh, this family, after we've defined their needs, or helped them define their needs, they may need a tutor in order to really be able to help that need. With wraparound, we're looking at like, well, who is that person? Not just the service, but the person. So it's really about people providing those services and their expertise, but also their relationships and the cultural fit. And wraparound really is about developing that, helping the family develop that, as far as a set of people that are going to be on a team that can help things.
Can I ask a question?
Absolutely.
I get real confused between system of care and wraparound because different communities use them interchangeably. Would you say that system of care is like a philosophy, whereas the wraparound is the execution of that philosophy?
Yeah, we even have a slide on it.
Okay,
In essence, basically, system of care is that overall viewpoint and philosophy and sets of values and principles. And wraparound is the implementation of those values and principles at the direct service level, at the street, with the family. And you mentioned different communities. One of the things that happens, almost unfortunately in America, is that sometimes in communities, wraparound is really the only thing that they focus on. And that's really, it's a wonderful process, and we believe in it dearly and do a lot with it by all means. But just that process of wraparound, if there's no system of care around it to support things, then really it's not anywhere near as effective as if there are supports up and down the ladder as far as the system is concerned. So it's how that's implemented at the service direct service level.
Thank you, I needed to understand that.
Did that help?
Yes.
Oh, good. Okay. So, really right at the bottom here, there's this thing called the National Wraparound Initiative, and that's a group of folks out in Portland State, and they are kind of like the folks that really do this wraparound stuff pretty well. They're kind of like a research base, an information base. We belong to it. We're one of 6 certified state sites in the state of Florida that have met the muster, basically, to the evidence-based practice of and structure of wraparound. And they're a great service, and they have a lot of good information. And one of the things I think that happens in an initiative, and when things are moving up to the point where there's a certain evidence-based practice or philosophy that's recognized, is you have to have principles. And so these are the 10 principles of wraparound. And to further confuse Lynn, as we have known, and within the neighborhood, but also services that are available really to everybody as far as that's concerned. That there is collaboration, and Beth talked a little bit about that before, and we'll go on to it again, but targeted case management in its current form talks a lot about collaboration and integration and coordination. I think with wraparound, that what we bring to that is that collaboration at the family level to where they actually really become a part of that collaboration and eventually actually lead that collaboration. And it's very important for transitional folks. If you're going to have a successful transition, one of the hallmarks of that in communities that have actually been successful with this is that youth coming into adulthood starts and learns how to collaborate with the systems and stuff themselves, to where they don't need us as much as they did before, but also where that collaboration, as far as the people meeting the needs, is still appealing to that person too. So, you know, my favorite, you know, I just have a lot of favorite kinds of things. But I'm kind of stuck in the 70s as far as hard rock and that kind of music.
Peace, love.
Yes, peace, love, and kumbaya, that kind of stuff. Well, but Led Zeppelin's in there too, as far as that's concerned. Yeah, well, all right, so that's not necessarily going to be appealing to probably 90% of the youth that we actually serve. So I may not be the one to be that best mentor. The other thing is they may see me more as a grandfather than they would a mentor anyway. But if you find somebody that makes that match, then that's a more important kind of thing. Again, community-based, we really want to provide services where the family chooses, but what's most appropriate within the community. So sometimes we actually see families come here or go other places and all besides their home because they don't feel comfortable with families or with professionals and people come into their homes. So it's really more about where they want it to be. So the definition of community-based isn't always just in the home. It's that blend of least restrictive, but also what the family is most comfortable with and chooses to. And we talked a little bit about cultural competency, and we're going to do that again. And again, it's about the individual cultural competency. So I may look very similar to other late 50s gentlemen that come from Ireland and been around here for a couple of generations, but we may be very different from each other. And so it's important to kind of know that individual side, which leads right into that individualized thing. I won't talk about that anymore. Our whole service delivery system is built on defining the strengths of the families that we serve, defining your strengths, defining the strengths of the team that works with families and the service systems that work with families. And so this is not about basically what's the problems, it's about what are your strengths. And oftentimes, if you really do a really good job of being able to define strengths within a family, those needs diminish in intensity and frequency. We don't believe in resistive families. I mean, it's really not a concept that we have here. And I think that's really important. There may be barriers, there may be things that have occurred in our families that make it difficult to move forward in a proactive way to be able to meet their needs and satisfy the child serving systems. But we need to look past it as being obstinate or resistant, and what is underlying that. And so we're tenacious with that. And I heard tenacious and consistency around here, curiosity, all those kinds of things is really what it takes. If you're really curious, what can a family do to get past what folks would call resistance in order to be successful? And so we're pretty unconditional. We don't give up. And I think the last one is that, you know, we look at like, well, you know, how do things look when they're better? And what is that? You know, and what does DCF require us as an outcome, but what do the family requires us as an outcome too? And what do we want for our families? So these are in essence principles of wraparound, and are they very similar to the principles of SOC? And they are very interactive. We don't do this in this thing, but if we get into trauma-informed care and the National Child Trauma Institute, they have 10 principles also, very similar to this in a lot of different ways. And so you find a situation where you're interacting with all kinds of principles. But I really do believe that if you kind of pare this down, it's like do unto others if you would do as you would have them do to you. I really think that's the main gist of this. So this is important. back in the 90s and the first part of the 2000s and all, when wraparound, there's a bunch of wraparound gurus and stuff in America. Family team conferencing, if you've had backgrounds in child welfare, it's actually from New Zealand model. They're very similar approaches as far as that's concerned about in essence us human beings finding the folks that need to help us. It's kind of like that. It takes a village to raise a child, that kind of stuff. But what was happening basically is there was a lot of critics that wraparound was just this kind of rosy, like thing about everybody celebrating all sorts of strength, but nobody really gets anything done seriously. And so that made the wraparound gurus and all pretty uncomfortable and stuff about things. So they decided, let's get this as structured as possible. And so we went on this quest of making things validated and structured and able to be replicated and whatnot. We're not there completely yet, and things have changed here and there, but there is a set of phases that's important to follow. We follow those here, and actually I coordinated one of our program Successful Students with Deals with Truancy is going to come in today, I think after lunch, to chat about the major program that we really apply this evidence-based practice to. So today and tomorrow we're going to give you the beginnings, basically, of what this evidence-based practice is and how it's important for all of us to really follow those practices. And then we evaluate and all how much you're following that fidelity. And it's not really rocket science as far as that's concerned. I don't think so at all. First phase is engagement and team preparation. And again, we're going to go through a whole lot of this in detail. Then initial plan development. Then implementation of that plan. And that could mean that you kind of go back and forth because like we said before, if the plan doesn't work, you change the plan. So this phase basically can really be a set of like, here we've got a family support plan, but oh, that's not working. This is great, this isn't. Let's go back and plan and see how we can change that one thing and be creative in order to get to the point where everything is working. And then we're going to get into a lot more detail as far as cultural competency is concerned. And again, let me reiterate that when we talk about cultural competency, it's not just an academic kind of thing. You know, we talked before about awareness, sensitivity. Somebody can be very aware of all the different types of languages and cultural norms and all sorts of stuff. If you watch the Discovery Channel and a couple other things, you learn a whole lot about all kinds of different cultures, that kind of stuff. It can be nice intellectual kinds of knowledge. You can also be very sensitive to things too. It's like you can have great empathy for the trials and the tribulations of the cultural group that you belong to or other cultural groups. But those two things actually, as far as we're concerned, are not enough. What's important basically is that there's action and responsiveness. And so when we say we want you to be culturally competent, one, we never expect you to become the expert because I've never met an expert in cultural competency. It's a practice. You continue to learn as time goes on, not only about yourself, but also about the folks that you work with, your friends, your colleagues. But what we expected is to be able to look at your practice and see that there are culturally competent actions occurring. So this isn't an exercise in intellectual stuff or in empathy and all. We kind of almost expect for people to kind of come in here with that. But what we really want is we want to see that in behaviors. And that's really the essence, because otherwise we really haven't made any difference. Our families might really like us and all, but if we're not really practicing, it doesn't make difference. And as we know from the research and the longitudinal studies, the more culturally competent you are and the more families experience culturally competent services and systems, the outcomes are much, much better. And we also really feel like the cultural competency automatically makes you child-centered, family-focused, youth-guided, and also community-based. So that's really the key to this, as far as not only we're concerned, but actually most of the folks that write about this stuff. So we've actually talked a lot about awareness, and the most important thing about awareness is that it's a blend between the knowledge and the curiosity that you have for yourself and your own background, for the agency, Kazuna, for the agency that you work with and the other agencies, and then blending that with Kazuna again, with the cultural, with a striving to be as culturally competent as possible about each family that you work with and in each neighborhood. So it's really a blend between yourself and the folks that you're working with. There's a lot of therapists, or almost therapists in this room, and there's this concept in clinical supervision called transference, countertransference, and I'm really not talking about the Freudian strict interpretation of that, by the way. What really talking about is what does the families that you're working with elicit in you, both positive, negative, conscious, unconscious, as far as the countertransference. And for them, what do you and the rest of the service delivery system elicit in them, and how do those responses come about? And then how do you figure all that stuff out into a family support plan? And again, it's knowing yourself and knowing them, and being comfortable with finding out about asking those kinds of things, and then respecting the values and the principles that each family has because of their culture, and probably most importantly, helping them be able to kind of surf that when their cultural values and traditions come against the laws and the cultural norms and all of our society. And one of the things that is important is the fact that, and Beth went into this before, is being able to help our families understand the culture of the different organizations and agencies and communities that they belong to and they have to interact with. Because oftentimes what happens is that there are disconnects, disagreements, whichever, that need to be processed and worked through. It's like this community-based stuff and the things that you're going to be required to do with our families. Is it's technically possible that a family that you're working with would never come to our office, would never actually have any interactions with Success for Kids and Families other than you. And actually to be organizationally cultural competent and to practice it in a community-based format, it's really challenging because of the fact that instead of folks coming here every day or several days during the week or for an hour, it's just you. And so y'all are our ambassadors basically. And what we want is for you all to really integrate yourselves within the culture of our agency. And our agency is steeped in these principles and values. We've really talked about a lot of this already. It's important to be knowledgeable of natural resources and also other resources as far as things are concerned in the community. I think that's probably the most important thing about this that we already haven't gone over. So, this is an academic kind of thing. The National Center for Cultural Competence at Georgetown has come up with this handy-dandy little thing called the Cultural Competency Continuum. We really don't expect you to go through this with your families ever necessarily. But what's important is to kind of fit it into kind of the framework that we have. And so at the top basically is issues of cultural destructiveness. And we know that in our community there are still entities that willfully go about destructive practices to the culture of some of the families that are served. Sometimes our laws and regulations aren't necessarily, while the majority may agree with them, there's significant parts of the minority where those practices are still destructive. Our immigration laws probably are the best example, I think, of this at this point. And I know that there's efforts to change them, and without going too much into my political viewpoints and stuff, what is destructive at this point in time is the fact that you can have children born here, but necessarily have a real threat of their parents having to leave, go back, very disruptive. And even if we make changes in those immigration laws, it's still going to be potentially destructive to the family unit, which could be the centerpiece of that family's culture. The next really is cultural incapacity. It's really where there is absolutely no ability with the child serving and the youth serving and family serving system to be able to deal with the specific cultural aspects of the family. And oftentimes what happens with that is then the family is expected to really drop a lot of their cultural strengths, philosophies, values, in order to conform with the service delivery system. And you lose so much because of that.
Can you give an example?
Of what cultural capacity? Yeah, I'll give you one about us, basically. So we have a rather large influx of Asian folks, families. Even that is culturally inappropriate because Asian means a whole region of our planet, having nothing to do with the fact that folks from that area come from Korea, come from Japan, come from China, come from Cambodia. We have an actually rather large Hmong population, which is a group of folks that were our allies during the Vietnam War in Cambodia, Vietnam. But then, obviously because they were our allies and we kind of lost that war, they were persecuted severely. And we have a whole bunch of Hmongs here, rather large population up in Pasco County. And we actually, and they're very spiritual folks. And we have no ability to be able to understand and provide services for that set of folks at this point in our service delivery system. Because traditional mental health or even advanced proactive mental health initiatives such as wraparound and system of care values really still doesn't mesh with that group of folks. And so what is needed is to build capacity in order to be able to understand what they will respond to, what's appealing to them, what their belief system is. So does that help?
Yeah, I guess I remember from the old SED charts that the Asian community was very low, percentage-wise, for the mental health issues. Is that just that it wasn't measured correctly? I mean, do you not have capacity because there wasn't a need, or have we not identified it correctly?
That's the top of the layer with that. It also gets basically the language. It gets into stigma. It gets and it gets into being able to understand that. What are the spiritual and religious issues that are so very important? What we see as a mental health issue may not be, not by any means, those kinds of things.
Okay.
And this is not meant to say that these are these things and that, it ends here, that there's these force fields between these things. What it is like when do our families interact with these kinds of aspects of the cultural competency continuum, and what can we do to help with that? So my son, who was a sushi chef until just recently, one of the other sushi chefs is a Hmong. And so if we ever had a Hmong family, I think we actually had one referred not too long ago, I think. But if we did, Tony, that's not his Hmong name, he's Americanized pretty well, had volunteered to help. And so that's that kind of stuff that's like really important. A little while ago we had a family that spoke, it was an Arabic family?
Oh, we've had all kinds of different languages too, and cultures, as even coming from Asia or Africa, where there are small countries there, and had created a challenge to really find somebody that was fluent in their languages. They were learning English, and definitely we've had that.
It speaks to the diversity within the actual cultures and our tendency coming from outside of their system to group these groups together.
Yep.
Exactly.
And trying as much as possible not to do that. And learning what are services and supports that can meet their specific needs within the state of Florida. And it's basically that everybody would be the same. and that you're blind to not only the strengths of a culture, but also the specific needs that they may have, not only in practice, but in language, those types of things. And that can be sometimes as destructive as incapacity and even destructiveness. Cultural pre-competence, like pre-competence, a lot of us actually are here with that. It's where there is an understanding, and maybe even some actual mandates legally, to be able to provide services that are at least linguistically in the ballpark for our families so that they can understand things, to where there's an awareness of the fact that you need to individualize and tailor certain services for certain groups. And these are usually your big groups as far as, okay, all those Spanish-speaking people or all those Creole folks and stuff. And the beginnings basically of adherence to a practice to where your service delivery, your paperwork, those kinds of things are adapted to that. Cultural competence is the next level with that, where a large amount of effort in your agency goes towards individualizing each of what we do in order to help the families that we serve, one, understand what's going on, being able to communicate with us, or through somebody, depending, to where they can actually get their needs met. And again, not only those needs that are outcome measures within the state or within the community, but also theirs. And then where people can play in that can help them with that. Cultural proficiency is when you're able to do that and adapt readily and fast to changing folks in your community. I've not seen a culturally specific community. And we travel a fair amount in a lot of different places, and we've not seen that yet. I don't know that I'll ever see it. Success for Kids and Families bounces most of the time between these two things. Occasionally we kind of regress over to that, but not very often anymore. I actually really haven't seen us do that, quite frankly, in a while. But we bounce back and forth with this a lot. And it's because, for some strange reason, Hillsborough County doesn't stay stagnant as far as the population of people that live here. And it's just not. Nor do the socioeconomic issues, nor do any of those kinds of things remain static. And I think that's probably the most important thing about, if you kind of look at this continuum thing as a helpful tool, is that the families we serve will never be static. They're going to change. And even within it, my set of practices and what I like and what I don't like is similar to my children's, but they also have some very, very different types of things that they are appealing to them, that they believe in, those kinds of things. And some of my stuff is very worthwhile. In fact, actually, I think most of my stuff is very worthwhile. Some of their stuff, though, is too. And so even within our own families, as generations go by, those kinds of things continue. So it's really about ever-changing, kind of a circular process. And it's never static. And that's why I've never seen somebody that's actually really culturally competent, and I've never seen a community that's proficient in that. We all pretty much practice it. And we'll practice it until, hopefully, until we die. So it's about knowledge, beliefs, and behavior. And in the system of care philosophy and values, what is really important is the stuff that we bring from past generations to future generations. We're doing an exercise in a little while about this. Thank you, Mark. About this that kind of exemplifies that. Because one of the things that we really want to do is, and we see a lot of folks, a lot of families where the children are born here or have lived there most of their lives, but the parents and grandparents were born someplace else and come over here. And we don't want to throw the proverbial baby out with the bathwater. There's a lot of value and maybe the keys to success with the families, the generations and stuff that are there that have come from other folks or other places. And our society used to, for the most part, say that's terrible. And there's quite a few people actually who live in our community that still say, if you live here, you gotta assimilate. Well, there's some things that are necessary with that, but if you assimilate, don't leave the traditions that are helpful and that are important. And so again, it's about customs and interactions, dreams, memories, common goals, familiar patterns of communication, language that's very specific, I often give some example and stuff like that Beth gets uncomfortable with.
No, I love this.
Oh, you like this one, all right. So I have a grandson too, he's 5 years old. He will, actually, one of the reasons why I think I'm having trouble with my voice today, we were walking the dog last night, I have 2 dogs, and we've taught him to let go of the big dog if the big dog sees squirrels, or possums, or other dogs and stuff, and I think this one literally was a hoot owl, because it was wounding and that kind of stuff, and he was off and back. So I yelled a couple of times at Mick, the dog, to get back, and it closed right up, so I think that may have been what was going on. But he has, that wasn't easy. What he has basically is that he was coming over here to our house and he says, I need privacy. It's a great, 5-year-old concept of privacy, all right. He's getting all these sophisticated things down. And so, he said, well, okay, I'll kind of go up to the kitchen. And he says, no, I need privacy. Come to find out what that is that's his way of saying he's got to go to the bathroom. So, very private person, that kind of stuff. But, he got that. Obviously, that was developed not in our house, basically. And then we found out that basically that's a very specific language for him. And of course, now it's integrated with us. And so if I have to go to the bathroom, I say I need privacy, and it's all understood now. And if you didn't know our family, you wouldn't know that that was the case. And even family members don't necessarily know it right away. And so it's there, to be culturally competent is to kind of understand some of that real specific stuff. And for the most part, these heroes, villains, hopefully that's within their own culture, and maybe even within their own family group.
You've done that quite well with the Star Wars and the Star Trek stuff with Jackson. So.
Star Wars.
Yeah, but you also have Star Trek stuff.
Yeah, well, that's true.
I'm
So-
a Star Trek.
Oh,
Are you really?
Yes,
Mr.
ma'am.
Trekkie?
So when you're asking about beliefs or certain customs, or when you're talking about assimilating into cultures and things of that nature, how as a provider do you go in outside of observing? Do you specifically ask, hey, what are some kind of, stories that follow you throughout time, or, that thing, and I know put on the spot asking things you do within your family that other families don't, you on the dime, you can't think of, okay, when I gotta go to the bathroom, it's privacy, or things that nature, so how do you,
I just
that's
ask them,
irrelevant, but
Yeah.
when it comes up, I'll just ask if they say a phrase or something I don't understand. I'm like, what does that mean? That's curious. I've never heard that before.
but I mean, like, when
or
you
something, but-
assimilate and trying to respect their culture,
Google.
even if it's, what if you they have some cultural
it's not
beliefs
that
that
obvious.
are interpreted negative or have negative consequences behind it, how do you respect those beliefs as well as educating them that they're not appropriate in this
I know what
culture?
you're saying now.
And that's actually one of the challenges that we face, because oftentimes, especially if we're dealing with folks, families that are not Americanized, to the point even that is the case. And even that, I just said that's actually has aspects of cultural insensitivity. But to go with that for a second, there are families and all that we serve whose parenting practices are very accepted in their culture, but are not accepted at all in the laws and regulations and all. And usually that's how come they come to us, because they're involved in child welfare or one of the other types of serving systems and all. And I think it's important to start off with the fact that everybody is on an equal level. You're the expert in mental health and in targeted case management and wraparound. They're the experts in their family. And to establish that respect first off, and then quite frankly, I consider all of us students of the families that we're serving.
Tell me your family story. Tell me what your traditions are. What do you like to do together as a family? And a lot of times that'll get you going. I know John and I did a system of care practice review, which we'll talk to you a little bit about later. We went into the family's home, and it was very evident what their culture was. Everything was about hockey. So they had a culture around hockey and stuff like that. And if the case manager could, they should use that in driving what they're doing. But there's nothing wrong with asking the family. Now, you don't go in and say, what's your culture, unless you say it and follow it up with, tell me about your traditions and stuff like that. But, tell me, what do you do? Do you celebrate the holidays? I had a Wiccan family at one point that we had to work with. Yeah, I'm very Catholic, but, doesn't matter, they're Wiccan. I looked at it, I understood what they believed in, but I helped them through the process. And help them to, use the skills and the successes they had in that in order to do what they needed to do.
I wanna bring it,
And also would help, quite frankly, to read the assessment that we do, because the assessment that we do very much gets into those kinds of issues.
I had to transfer the case last month because of the contract ending. It was Asian and Caucasian, and situations stem around where cultures collide. And sometimes, again, you have one culture over here, different, and you have another one over here. Well, in this particular case, it was a married couple also. So sometimes you have to start with those two and work backwards, because something drew them together. And so sometimes you want to start there. I mean, family is going to have a real big impact, because this family I was dealing with was Korean. And part of the problem I had was I don't speak Korean. Her English was very limited. So I got a translator from the county, but a lot of times I had to use her daughter, who was part of the problem, to translate for me. Exactly. So I got a little savvy with my iPhone, and I downloaded this Korean app, and I would say in English what I want, and it tells her in Korean, and we kind of did a little thing back and forth. But the bottom line is, sometimes you just have to start with the two individuals and work back and hope to find a common ground.
Yeah, and I think one of the things too is that we have time. Discharge with us has a lot to do with making goals, and when goals are attained. And while we have about a 6 months typical, we've done this for years, average length of stay, that's not necessarily at 5 months and 29 days, and we're going to be ready to say goodbye. That's not the case. I think Marcia and Kathy, who are the two supervisors, are very, very, very flexible in those meeting needs within time frames. You got to talk to them about it. That's very important, but still, there's a flexibility. So we've talked about this before too. What's important is for all of us and for the team as it's being formed with the family, and to assist the family too, to understand all of the cultural differences, but also mandates of the child serving systems. And so, child welfare is about permanency and safety of the child. No matter what, that's their mandate. And, Beth talked about earlier, we've got to respect that. So if we have a family that's involved in the child welfare system, that's something that they're going to come to, they're going to come to that team with that mandate. And what we have to do is to be able to respect that mandate, and at the same time, help the family and the youth meet the needs that they have. And, when you talk about clashes, that's often the case. So it's not easy, and it's very, very complicated. Almost always, when there's a clash between the mandates of a child serving system and the family, the key to success is respect. And respecting it equally. It's very important. So anyway, mental health, emotional healing, juvenile justice, public safety, those are the mandates that each of our child serving systems have. And effective wraparound programs are real good at balancing those clashes and balancing the different kinds of mandates that they have within the family culture, to the point where if there's a consensus and a place to meet, great. Some situations are such that there is a need for change within the family, otherwise terrible things are going to happen. But respect is still the cornerstone.
And I think helping the families to understand this is important as well. A lot of times they just see these agencies as bad people that have come in to do bad things to their families. But helping them to understand as best you can why this is occurring and why they have to do it. Sometimes gives them the knowledge, and knowledge is power. So.
That Haitian family example here.
Yeah, the Haitian family example is great.
So several years ago, we had a family that we were working with. They come from Haiti. The family was into fairly deep with the child welfare system, predominantly because of the fact that the culturally accepted parenting practices of the father were against the law here in Florida. And we have this thing called Chapter 39 of the Florida statutes that outlines those kinds of things quite well. I think that's actually in, don't we have Chapter 39 in there? Darn, we need to put it in there.
To read?
Yes, ma'am.
It's not in
Yeah, it's not. However, it's interesting that Ty's the one that actually said that, because you're probably most familiar with, of all the people in this room, I bet you're more familiar with 39 than anybody else is. But long story short, it says you're not supposed to, harm your child to the point there's bruises, there's other things, those kinds of things. The whole family was actually, quite frankly, very comfortable with the father's disciplinary techniques, because that was normal for them. So it wasn't anything that was like, weird. But child welfare was involved pretty significantly. And so, long story short, what occurred basically was that our system navigators is what we call our folks, worked with the family and also the child welfare folks to be able to work out a plan of what's referred to basically as mutual respect. And so the child welfare folks, including the supervisor, which I thought was this was a stretch, but they did it anyway, is they went about a way of honoring the father as the patriarch, as the head of the family, his worth, not only as a person, but also at that role of a father. In return, that allowed him and his wife to get to a point where they were willing to concede some of these kind of weird practices and stuff like that in Florida. And so a compromise was made, is that he's the patriarch and everybody realizes that. And even though he thought it was silly, he took a parenting course and understood, actually, as Beth was saying just a second ago, specifically what were the requirements. And that worked. And the family, last we heard, is together and things are fine. And it was real critical too, because there was a bunch of processing and mental health issues and stuff with those children. And if they had been in foster care and removed from them, well, actually one of the things that would have happened is his mom and dad would have probably been back in Haiti, like in no time flat. They would have lost their core and their identity and their family. And they would have ended up criminal justice, it would have just been bad. And what really happened with that is respect. And those are the kinds of things that you all are expected to look at and to do. And that's not only you, but it's also the folks that are going to be in these teams. It discovers and appreciates the cultural differences in each family. And it's our responsibility to ensure that each plan and implementation is agency and family culturally competent. And that's the real challenge with this. It's not just about being competent with the agency, which we're actually in America pretty good at, actually, to the chagrin of some of our families. But it's about doing both and having a consensus.
And I think it's important to help those other agencies that you're bringing to the table to think about the culture of the family, because a lot of them have not had and been exposed to what we're talking about. So, your role is to help them understand and think from that perspective, so.
And that being said, Hillsborough County is a very unique county in a lot of ways. And that there are, and have been over the last, especially specifically about the last set of maybe year and a half, where the level of collaboration and cooperation between the child serving systems, not all of them, but some of them, are much, much better than it used to be. And also the courts, which has been wonderful. We have more court cooperation and judicial cooperation with flexibility than we've had here, in my opinion anyway, in the last 3 decades. And it's wonderful, and we need to seize upon that. And luckily we're kind of in all that kind of stuff too. So we really do have a lot of backing for these values and principles, much more so than we used to.
Yay, now we get to play.
And come up with a dish that is significant to your culture. And that could be your culture of origin, it could be your culture of who you are, it could be specific to the culture of your own family, it might even be just specific to the culture of yourself. But to come up with a dish that has, in essence, a lot of meaning to you. And what we want is we would like very much the name of that dish and the ingredients.
John wants the ingredients, because he likes to duplicate recipes.
Yeah, and if it's really good.
I don't cook.
it's-
I will be happy.
And if it's really good and stuff like that, yeah. It's, but after that, and you may need to help us with the spelling, but after that, what we would like is we would like for you to describe what the context of that dish is. You know, how old was it? How old were you? Was it back in your childhood? And if so, who was there? Who prepared it? Was it around a specific holiday or a celebration, or was it a Wednesday night? What was the context? Who was there? And then what really kind of a significance of that on your life? What was that? Like, why was that significant? And maybe what was it that kind of formed who you are today? And then your emotional kind of take on it. What emotions does it bring up with you? And then last but not least and stuff, after we do this, what we would like to do is kind of like a definition of who you are as far as what your culture is. And so, like, how would you label yourself and your culture? Like, what would you call yourself? If you were filling out the red tape and paperwork that we have to fill out, what would you put as down as your race or ethnicity? What would that
I'd still
check?
probably, I can't remember if we have Caucasian
you
or
got
white. I mean, I'm still for
Caucasian.
race, I'm Caucasian, not,
So put down
I mean, I would still probably put American.
well, that's
down
not a
for-
category.
That's what I don't remember what your
Yeah,
categories
it's
are.
like, you know, you get like African American or black, Hispanic, Latino, or Hispanic non.
I guess I'd be like the non,
White, Caucasian.
I think we have like a white non-Hispanic then.
Yeah.
Yeah. that's
Yeah,
probably
I
what you
guess
put.
I'm,
So you put a white non-Hispanic, okay.
African American.
African American,
White,
okay.
non-Hispanic.
And so, does that, if that's the only thing that we find out about somebody's culture is what that is that enough?
no one, like I said, like I would put that because like from a racial standpoint I'm not, but culturally, I have all the Hispanic.
Mm-hmm.
So it's not even, that's what happens a lot of times when it goes like that, when it's only by the not Hispanic, white, whatever, it's not very,
And so,
not very
really,
descriptive.
yeah, and so we have to put those little checks and stuff like that, because that's mandatory and all on our paperwork and whatnot, but we need to do more than that. And we need to find this stuff out, because I think that Lynn and Ty and Allie are much more interesting people if we know what this is about, as opposed to those kinds of labels and all. And,
I love the word eclectic. So be mutt, which is what I think for myself.
well, thanks for the participation, and everybody actually that did this, thanks a lot. That was, you know, as we were walking around, it was obvious that everybody was getting into it and whatnot.
It was very emotional.
It always is.
Brings back a lot of
Mm-hmm. And you know, I think that's also something that those kinds of woes, because we all work through those all the time. You know, it's like all of us have trials and tribulations, and we manage them, and that's actually a strength, even though sometimes it's painful. You know, and that's the same challenge our families have.
It's that tradition in the face of grief
Mm-hmm.
carries on.
And sometimes, just quickly, dish I made, the dish I mentioned was something that I did as a child and my parents did. It was just, now I do it because my parents are no longer alive. I do it, sometimes it's tedious and it's like, oh my God, here I go again. But bringing it brings me the memories, the aroma, the smell, even when my children or the family members here, it's just those good memories come back. But my fingers and my body don't feel too good when I'm doing it because it's an all-day process.
What are you making all
All right,
day?
yeah, we gotta ask then.
It's called pasteles.
Oh, yeah.
Oh gosh, and I even have pictures because one of my neighbors, I did them and my son's up north, and his fiance was leaving in Thanksgiving to spend Thanksgiving, and I sent him some frozen ones. He was like, yes, and he told her, we gotta learn this process. She goes, oh no, we have your mother for that. But the point of the matter was, it was tedious because it took me, and it was late. It was like 1:30 in the morning. I'm like, I want to sleep. But when he received it, he was like, he started smiling, and it brought back his memories of when he held. And now my grandchild sits down, and every time you mention the word, everybody goes, oh, but they still come, we laugh, we bond, it's joyful.
Mhm.
But it brings back the sad memories that my mom's not there. But I continue to do it because I want them to have something to carry on.
And you know, that's honoring, it's honoring our relatives and something that's tangible.
And tradition.
And tradition, and that's just a kind of a critical thing.
It is, it's important to me.
You know, a couple of slides back when we were talking about, you know, like past generations to future generations. I think this is the other thing too, is that in systemic care and wraparound, this is really something of a focus, which is one of the reasons why I really like this type of philosophy and value system and practice system, is because it's not just about like taking just like whatever the heck's going on now. It's looking at what was valuable, sometimes very emotional, but still from our past, in order to be able to like work with us in our present and to make our futures better. And that's the kind of stuff that we got to work on as far as our families are concerned.
But I learned how to tweak it a little, where we used to use a lot of the pork and a lot of oil, and now I'll do pork chicken, or I'll do veggies instead, to kind of like make it a little healthier. And a member, somebody told me, well, why don't you just change all of this and do this and do, I said, no, you cannot change too much of the ingredients, because you lose the essence and the tradition.
But you can adapt. Well, and you know, it's like
But I adapt.
Yeah. And I'm you know, Irish Catholic, kind of half German, that kind of thing, but I grew up just outside of Ybor City, and I grew up in a neighborhood where there were Cuban and Italian families, and my mom, you know, they all like knew each other really well, obviously, and so a lot of the dishes that she cooked and a lot of the dishes that my sister and I cook now are like either Cuban or Italian, and we've changed chicken and eggplant parmesan drastically over the years, when all of a sudden our hearts said that no, you can't eat fried foods anymore, you know, otherwise you're not going to be here. And so we bake a lot of our stuff now, and there's a little bit of a difference, but quite frankly, then there's acclimation. And it's like now when I actually eat something like at a restaurant, if I eat fried, like eggplant parmesan that's fried, I don't like it. Whereas because it's baked, yeah. And then my sister, who would fry it all the time, over the last couple of years and all like that, is actually beating me with the stents in her hearts.
4 cents later or
Yeah,
something?
yeah. She's that's one thing she can beat me on, and I'll be fine. But now she's baking her chicken and eggplant parmesan, because she married an Italian guy after a couple of other lives. And so there is this thing about like getting to adapt, which is really important also, and that's also a skill set. And if you see that in a family, that's another skill set that they can use for something else. Coordinator of successful students. And successful students, this may not be that bad, because we've got to go through the phases of wraparound yet, and so we haven't actually done that because we didn't get to it before lunch.
Okay.
And so actually this may be pretty good, because our successful students is actually our, if you will, demonstration project and implementation project for high quality wraparound. And so everybody that's involved with the families that come specifically into this part of our agency, and the case managers, that's what we do, is wrap around with that. And so she's going to describe her program, and then what we'll do is later on today, we'll actually get into how that actually works at the street level. So we're really lucky to have Nancy. She was a contracted person, just the same as you all, for a while with us. And then as we were able to offer her a position as coordinator of this very special I think, program of ours. And as I gave an example of Marcia earlier, the thing that Marcia just said, that was actually Nancy. So she was actually singing the praises before you came in.
Oh, thank you.
Your ears should have been ringing, I didn't know you would put it.
I was trying to navigate the Howard.
Yeah.
Did that happen early?
I came this morning and it was like that. There's no sign or anything.
I thought the sign said that it was gonna happen next weekend.
Yeah, I don't know, so.
Oh, which is probably what Selena's doing,
Yeah.
because she would be doing the same thing.
Oh, yes, yes.
That's right.
So someone might need to give Selena a call, because I don't know how great she is with having to deviate from the way that she's used to go. What we're doing is using high-quality wrap for truancy population. So in coordination with Truancy Court, which is Hillsborough County 13th Judicial Circuit, and Hillsborough County Schools, together I guess we all identify which students, which families would benefit most from this very intensive service and get them to participate. So we've got elementary school kids that we're working on, and they come to us through the schools and also through a committee that meets to discuss school attendance for elementary school kids. Those kids, it tends to be more the parental issues and trying to get more the parents on board. And then we also get referrals from truancy court. Those are your middle school kids, and there it's kind of a combination between the parents and the kids at that point. So we assign case managers, again based on who we feel the family's going to gel with the best, and what areas of town they are, maybe expertise. And you guys will go in and you're going to get into all of the high quality wraparound stuff. So I was coming in assuming that you'd already done that.
Sorry.
No, it's okay. When we first started this, a lot of the case managers were used to doing, case management. And really, they didn't want to do this. They were like, no, don't give me those cases. I mean, I remember people getting up from the table, just like, no, not even listening to this. This is not what I want to do. Now, I have people coming up to me like, oh, can you give me some more of those truancy cases? I want those cases. I think what they're finding is with the change of funding contracts, Medicaid has really limited what we're allowed to do on a lot of our cases. And with successful students, we have much more hours that we're able to allocate for case management. We have a nice pot of money that we can dip into to do those incidentals, to do stuff that the kids might not get a chance to do, to actually reward the families and provide incentives when they're doing great. We had a boy who's been attending school up at Dorothy Thomas, the Kids in K-9 program. I need to talk about that a little bit too. I always forget about them. But he'd never attended a full week of school probably since second grade. And now he's starting to attend regularly and he's liking it. He's kind of getting back into the swing of things, and we wanted to reward him for that. So we were able to offer him like a gift card to take his dad to the movies, or take his dad out to dinner, and just kind of, we celebrate those successes and let the families know that, there's rewards and to making these changes. Let me see, I need to get my PowerPoint. So Kids in K-9 is also a part of our pilot program. They are taking those kids that just are not a real good fit in middle school, and there's a small class up at Dorothy Thomas. They're not with any of the other students. They're kind of on their own. And they're assigned a dog that they work with. And this is dogs that are being trained to be companions, to be therapy dogs, to be... Kathy, do they ever get to be a guide dog, or is it mostly...
The dogs get trained in all different components. What they do is they train service dogs to help people in wheelchairs, turning on lights, things like that. But found that not all the dogs end up qualifying, so they train them to be autism dogs, which they actually leash them to a child who's autistic. They train them as, I got one as a therapy dog that I actually have at my house that I used to bring to hospice with me. So they've expanded. But the key to what the Kids in K-9 program does is they make the kids have a commitment. They say the only way you're going to be able to train this dog is you have to be here every day. So they take the emphasis off of the education, the school process, and they say this dog needs for you to be here every day because they cannot miss a day of training if they're going to be what they need to be. Which then the kid learns, if I don't miss a day of school, I can become what I really want to be. So they use a very good lesson with them. And the one lesson, and the woman that runs it, the one lesson the kids walk away from is if the dog cannot learn a skill, the first thing she tells them, it is not the dog's fault, it's we're not teaching the dog properly. So then the kids also learn the lesson is, well, maybe if I don't understand my math, it's not my fault, but I need to learn how to do it in a different manner. So that program, that's a component that they bring for these children, so they finally feel successful.
Interesting.
And it's been remarkable to see some of our kids who, this one child just put his head down in school. He just gave up. It wasn't a behavior problem, but he wasn't doing a thing, just wasting his time. And he's been in the program, I want to say since just about the end of the last school year. So it hasn't been a long time for him, but it's just been a remarkable change. His teachers are saying that he's very social, he enjoys coming to school now, he's talking more. I mean, it's just been a life change for this particular child. And a couple others who just did not fit in, were constantly bullied, didn't want to go to school. Now they feel like, they're a part of something. They've got that, they've got the dog there. So it's really rewarding to go and hear how great they're doing. And they put on, they go out into the community and will actually do demonstrations with their dogs. So they get to show off a little. So, but that's just a very small portion of some of our truancy cases. So I think if you guys are interested, you'd really like having those resources, the freedom to really get creative with these cases, not having all those the restrictions of Medicaid. And I think now our case managers are starting to realize that it's very rewarding. It's very rewarding. So.
I'm not saying describe a life in the day of one of your caseworkers, but what are they responsible for doing as a caseworker? What's their job? Like, I know their goal would be to get the kids to go back to school regularly, but what kind of things do they do with the family to encourage?
Yeah, I mean, you're gonna, we go in and we do one of our regular assessments and kind of figure out what's going on. When you're doing your family team meeting and you're doing your family support plan, what does the family feel that they need? Are there any recommendations that other people have brought up? There's a long engagement process with these cases that we found. It's a little bit different than someone calling S4KF and saying, hey, I want services for my kids. These are the families that, they've gotten into trouble with the school system for not sending their kids to school. They're just right underneath the radar. And so once we get in there, we really need to get them to trust us, to build that relationship. Then we find out what's really the issue. Is it mom is having mental health issues, doesn't want to send the kids to school because she's afraid something's going to happen to them, or a parent who keeps their kid home so they can help out with the little ones. There's a number of issues, and until we really get in there and develop that relationship with them, it's unclear where we're going.
The biggest difference, the only difference is we treat all our families the same exact way, but with the successful students is we have a longer period of time. You don't have to count your hours, you just have to justify how many you're using. We do this with Medicaid, but if you have 8 hours approved for Medicaid, you only have 8 hours that month to dig this stuff. With the successful students, you have the same, you're gonna do the same things, but you can use 8 hours in a week if that's what the family needs. You can attend school meetings with them. You can bring everybody in. You could take 3 months building a team around this family to really get at the root of the matter, which is really the most important thing. It's not we're doing anything different. We just have the availability to do more intensive types of programming. Because I just wanted to say that because I want to say we treat all our families the same. We put the same amount of effort, the same amount of intensity to all our families. But in the successful students in some of our diversion cases, we don't have to count the number of case management hours we put into it.
Thank you.
And I think what that's an example of is a lot of wraparound programs around the nation start off with federal grant SAMHSA money, Substance Abuse and Mental Health Services Administration, which is where we started off from 1999 to 2004. After that, though, when the federal money goes, which gives you carte blanche to do pretty much all of the stuff, well, if there's still structures to it, but I mean, you really have enough time. And time is really of the essence here. With some of the funding sources, or with all of the funding sources that you have available to you after that federal grant ends, there are lots of constraints to them. There's lots of rules and regulations that are different from the federal money. And what we have done since 2004, and especially since 2005 when we incorporated, is to try to blend the practice of systemic care and wraparound with adherence to the requirements of those funding sources. And then those funding sources change. And so today, which is kind of what I said right when we came back from lunch, it kind of goes right into that, is that there are more structures and restraints in certain funding streams that change and we haven't been able to have influence on. Where with this, we've actually had to have a lot of
You know, they basically thumb their noses at the system for a long time, up until they get to what the school system considers tier 3. You know, they've gone so far in what the school system can do, and now these people are involved, you know, legally, you know, so they will tell the judge, or they will mention to the school system, yeah, I need help, you know, and so it's up to me, and it's up to the case manager to get them to realize, hey, we're separate from the courts, we're separate from the school, we're not here to police you. You know, your ultimate goal is to not to have to go to truancy court every month. What do we need to do, you know? So you're gonna work first on, you know, stabilizing the family with, you know, the goal of, yeah, let's get the kid back into school, you know? But it takes a lot of stabilizing the family sometimes until you can get to that point to even start addressing getting into school.
And I think it's important to note that truancy can be a culture in the family as well. When I was a teacher, I had this young lady by the name of Shannon who was truant, second grade too, sent the social worker for the school out, came back the next day and said, oh, I used to chase her father around and he was very truant as well. So it is that, and their family, going to school, they didn't have that value of education. And so, you know, one of the things you guys can help with that is to look at that culture, help them see a different value and maybe the why it would be important and help them understand why the school district wants them to go to school. So you get to do some, you know, some good education and maybe change a child's life, so.
and discover the strengths that that family has, and in the hopes of being able to generalize those strengths to the specific issue of going to school on a regular basis.
For Hillsborough County, has been giving the kids kind of an incentive. You know, when they're in court, he'll say to them, hey, I'm putting you on the docket for such and such date, but if you have perfect attendance, you do not have to come back. And of course, the parents love that because they don't want to have to take off work and, you know, get there. And so we had a number of cases where, you know, I wanted the case manager to show up, you know, even though the family wasn't going to come. And sure enough, I think like 5 of our kids out of that 8 had perfect attendance, did not need to show up. But the best part was having the case manager, who's been working with this family for months, be able to, you know, sit in front of Judge Stoddard, and Judge Stoddard had the whole court clap for them. And what they had been doing for those families. So, because I really feel like they need to know they're appreciated. And I think we do a really good job of letting them know. But to have them, you know, be in that formal kind of structure in the courtroom and, you know, to know that everyone else is kind of watching what they're doing and are appreciative. So it was really great. So they were beaming. So he is, Judge Stoddard's very appreciative. And I think what, he does a really good way of describing the truancy cases in his courtroom as these are really child welfare cases that are just under the radar. They just haven't come to light yet for a number of reasons. And he is, I don't want to use lenient, he's understanding that sometimes there are a lot more issues at play that we need to address before we can even get to the truancy. So he's been great about not sheltering a kid. I'll explain shelter. He has the option of sending them to the Lake Magdalene shelter for up to 30 days if they're not complying with the order to, you know, to go to school. And he'll do that quite a bit. But if we're working with the family, we're trying to get services into place, and we're finally making some momentum, if we let him know that, he'll back away, you know, whereas before, that was his only hammer, you know? And now I like to think now he's got a carrot, which is us, to show their parents what they've been doing with, you know, with the dogs, so.
I mean, they put on a Christmas,
Yeah.
they put on a Christmas show every year. And I've seen parents go into, it's the first time they ever saw their child successful in school.
Wow.
Even if it's just walking around with a dog, it's the first time they've seen that child successful in school. They have weekend activities. There's a program down in Sarasota called Samantha's Friends. And it's a woman, she used to be in soap operas and a model, and she had a stroke or had a car accident or something. So what she does is she puts on this big fundraiser for people who need a dog that can't afford it. So they use the money to purchase the dogs for somebody who is handicapped. The dog I had actually went to a woman who Samantha Friends purchased the dog, because the dogs cost $2,500 after they're trained. So the kids, though, actually get to bring the dogs there and show the dogs and talk about their training in front of a group of people that are from all over the county and all over the state. So it's an incredible program.
I think that that's a point of advocacy for all of us, whether we be parents, whether we be case managers or whatever, to be able to really influence how, or what rather, Medicaid actually funds, or the healthcare reform monies actually funds. And one of the things that would be very nice is we would see things such as peer support, where family members that have gone through life and now are ready to get back can be funded through Medicaid to be able to do that. To where certain things that are under those incidental categories can actually be funded, along with the regular traditional stuff that me as a therapist, and I want to bill out for an hour of psychotherapy, can do, or myself as a wraparound facilitator can bill out based on the needs of the family because it's on the family support plan. All those kinds of things are in play right now, and we all have a voice that we need to get up to our folks that we elect to be able to make sure that some of this stuff is considered. And not only on the state level, but also, but I think primarily right now, especially because of Florida, is the federal level. So it's possible for change in this, and we could have a much better system. And that would mean that maybe for once and all, Claire and myself and all the good folks here can stop lobbying so much with local funders to be more flexible with their money because of the fact that it's in statute. That would be nice.
Yeah.
Regardless of conservative or liberal.
Incident reporting is an important component because we're dealing with tough situations and things go wrong, plain and simple. Even under the best conditions, things go wrong. So, incident reporting. Alrighty. This procedure establishes the guidelines and procedures for identifying and reporting incidents involving client health, safety issues internal to the agency, and/or as deemed reportable by DCF Regional Operating Procedure. I am in charge of the DCF contracts, so that's where my main focus is, and our policy is based upon the state policies, so that we stay in compliance. Now, there are some other side procedures, but individual programs take care of those requirements. But I take care of all the internal. All internal for the whole company comes to me. These do not replace the abuse, neglect, and exploitation reporting system. If you need to call the abuse hotline, you call the abuse hotline. Make sure your clients are safe before you do anything else. That is priority. Calls are made to the appropriate medical, emergency, or law enforcement personnel in the event of critical health or safety incidents. Remember to document all of these calls on the incident reporting form, which is in the packet that I just gave you, and we'll review that in a few minutes. Okay, critical incidents must be reported immediately upon finding out the incident to the Finance Data Management Administrator, that's me.
In your PowerPoints that I gave you, these slides are in there. I'm not sure what.
This is a little bit different.
It's additional information, so if you want to follow along, use the
Yeah.
ones in the handout I gave you.
It kind of breaks it down a little more basic, I think. But if you ever have any questions, pick up the phone and call me. If I don't answer it, leave me a message and I'll get back to you right away. Because to me, the only stupid question is the question not asked. And if I don't, and that pertains to anything, even besides incident reports, because I am in the building a majority of the time, not like some of the case managers and the intake personnel and stuff like that. If you have a question, ask me. If I don't know it, I'll find out the person that does. You know, because you need to have answers, plain and simple. So, and I'm there to help in what capacity I can. Let's see, where are we? And you also need to contact Kathy and let her know what's going on with your clients. If it's after business hours, you call, leave me a voicemail, fill out your incident reporting form, and email it to me. That way it is waiting for me first thing in the morning, and then I can address it right away. Because even if it's after hours or over the weekend, it still needs to be addressed immediately once the office opens back up.
Is that form also on that big tent? Okay.
Yes, the forms are on Big Tent.
Okay.
The forms are also on what we call our intranet, the S4KF, and for in-house people, they have access to that. So if you need to come in the office and get a copy, don't have your computer with you, we can pull one up for you as well. So, now
But
these.
we like it electronically filled out.
Yes, because I save them electronically and I have to pass them around to keep them in the loop whenever there's things that need to be, information that needs to be passed around. These incidents require to be sent email and password protected. I don't think that's on this particular slide. But password protected is very important. Unless you're working internally with s4kf.org emails, it's not secure, and we're dealing with confidential information. If you're unsure of how to password protect a document and you have a laptop, come into me with your laptop and we'll figure out. Each program is a little bit different, each window versions.
Don't ask me.
But bring your laptop in and we'll figure it out. Because it's very important. I get way too many not password protected, and it scares me. Because information out on the internet is there for the grabs.
And there's a $10,000 fine per incident per person for a HIPAA violation.
And that is one of our critical incidents too. So.
Oh, not password protecting.
No, the unintentional leak of confidential information.
Right.
So, okay, if you're not sure if something's reportable, pick up the phone and ask. Okay, you complete the incident report, send it to me password protected. Reports on child sex abuse, death, media reports must be emailed immediately. I have 3 hours to respond to this from the time that you find out. So that doesn't leave much time. And the reason for that is our managing entity is Central Florida Behavioral Network. They have 4 hours to respond from the time we find out to respond to the state. So time is very, very critical. Now, once again, if it's after hours or on the weekend, have it ready for me for first thing in the morning, and we're covered. You may need to provide daily updates regarding certain situations to me as well as to Kathy, and you want to keep detailed progress notes. That's very, very important for all of your transactions with your clients. Okay, critical incidents. The ones that you're going to see here that are darkened, they're highlighted, those are the ones that are critical. They're all called critical incidents, but there are several that are super important. Child-on-child sexual abuse, child arrest, death, elopement. Now that means run away from a facility, not run away from home. Employee arrest, employee misconduct, escape, once again, that's escaping from a facility. Some of these are not gonna pertain to us because we are not a residential program. But like I
we do
said,
case manage some kids that are in residential, and we've had one major escape artist in the last year.
yeah, now, though I didn't have to report it to Central Florida because the facility that the child was at was really responsible. We need to follow it and make sure that appropriate things are being done to correct the situation. Missing child, security incident, unintentional, like I was just saying, significant injury to clients, significant injury to staff, suicide attempt, sexual abuse, and sexual battery. Human acts, bomb or biological chemical threat, and we've actually had one of those. Theft, vandalism, damage, more than of those than I care to think. Death or significant injury. And this is another important one, events that have or may lead to media reports. Now this is not, just a second now, you'll have. This is negative media, not positive media. Altercation, Baker Act, medication error. Human acts.
Yeah, that's what was my question.
Okay. That was explained a little more in here, I believe.
Human trafficking?
No,
Would that include everything?
People doing bad things
to each other.
to each
But this,
other.
that
Well,
kind of
that's
covers
most of
all. Have until the end of the day to get me an incident report. Then that takes a little pressure off of you. You know right away what is required. We've had some problems with this information getting to me. Err on the side of caution. If you're uncertain, do it. If you're uncertain and don't do it, and then I find out 3 weeks from now that you knew about something and it ends up something that needed to be reported, we're out of compliance and we get dinged. And that's not a good thing. Too many dings and you're out. Fortunately, we've only got dinged once because I tried really, really hard not to have that happen.
Yeah, we don't like it. Not at all.
You know, these people give us money to stay in business. We want to keep them happy. So, let's see. Yes.
We get lots of questions from, our different case managers about death or significant injury to family members. They're often unsure
They
about
are
that.
not our client unless it's the client themselves that gets hurt or, heaven forbid, commits suicide. We don't have to report it. But that does not mean you don't need to document in your progress notes. Because if a parent commits suicide, that's gonna have a traumatic impact on that client. So you need to have it documented and move forward.
Yeah, and you need to talk to your supervisor because the needs of the family might be extensive if a family member is injured or dies. But it's often confused in the case manager.
Right.
About whether or not it's an incident report, so.
You know, if
we
the
need to know
parent
about
gets
it with the
arrested,
supervisor.
I don't need to know. You need to document it, but I don't need to know.
But Kathy does.
But yeah, Kathy does so that we can take care of the client. But that doesn't fall under the
Right.
policies and procedures
Right,
for
exactly.
incident
But we have a lot
reporting.
of questions about that, so I just wanted to.
That's why I say call me,
Help you
because
out.
there are so many gray areas. Nothing happens by the book, you know? So call, we'll talk about it, we'll figure it out together. If we have to get John involved, Kathy involved, my boss Pam involved, we'll figure it out one way or another. I might have to call Central Florida.
And I actually, since I'm about 3 rungs up the ladder from this whole thing, if I'm involved, then things have not gone well. So I like to not have involved in any of this kind
You
of
know,
stuff.
I grab whoever's handy to ask
Well, that's true, she does.
questions.
She'll come into my, if there's nobody else there, she'll come to my office.
Because if I don't know, I need to know.
Yeah.
I want to know.
So self-cutting.
Oh, definitely, definitely.
What's key? There's 2 key things here as a case manager you need to worry about, or know. One is, you're gonna do a safety plan, you're gonna learn about that. The safety plan is what generates the family's phone calls and what they're gonna do. You should not be their first emergency phone call, okay? So if you have a strong safety plan, the child may end up doing something, getting arrested, you may not find out until you do the next home visit, okay?
And that is fine. It's
So-
acting on it when you find out.
Right. The other thing is you may have a family that will call you. Make sure you are in a position to, one, field the phone call and act appropriately. We had an incident where we had somebody who was out with their family, out with their husband, 2 hours away from their home, got a phone call from a client, picked it up and started talking to the family. And the client was suicidal. Now, she's in a dilemma. Okay, now I've had a couple cocktails. I don't have access to a computer. This is a critical incident. I need to do this incident report within a certain amount of time. Now, do I leave where I am? You know, so there's all these things that get built into that.
Yeah.
So be cautious. You do not have to answer the phone every time your family calls. You are not there for emergencies. That said, you make sure you tell the families when you're going to be available, what you need. If your family says to you, listen, this is going on, I'm really concerned, and you say, you know what, I'll be home Saturday night, feel free to give me a call, that's different. But if you're going to go out, you're going to be out of town, you're not going to be able to respond the way the policy reads for you to respond, make sure your
Don't
families
answer.
know that. Make sure I know that. Make sure somebody knows that. Or make sure they have a strong safety plan.
Another
And-
note, oh, sorry.
Well, what's really important about that is again, this team thing, and we're gonna do a whole lot more about that this afternoon, tomorrow. You are not the Lone Ranger. You've got a team that you and the family are forming, in the process of forming, or have formed. And so there needs to be some folks on that team that actually have what the credentials that they need to have, such as licensure, those kinds of things, to deal with Baker Acts, to deal with all those kinds of really dangerous to self or other kinds of things. Regardless of where you all are at, and most of you are master's level therapists, registered interns, those kinds of things, you're actually not a therapist in this role.
Right.
And so you need to have a therapist if that's a need of the family, and it almost always is as far as our families are concerned. And that's really important. We'll drone this into you ad nauseum, believe me. The next thing is that with every one of our funding sources, there is an identified client. Because the way you get money as far as mental health is concerned, medical is concerned, is you have that identified client. We serve the whole family, but the client is gonna be the child or youth that we put in. And that's what Selena was talking about earlier. So Bert is the identified client. The mom and the dad actually may be receiving more services than actually maybe perhaps Bert is. But nevertheless, if Bert decides to attempt suicide, that's an incident report. If mom decides to attempt suicide, that's a treatment thing, and Selena doesn't even have to know about it.
Right. And the other important thing is to know is if you have a parent that calls you next day and says, my child got Baker Acted, it's really key at that point not to just do an incident report based on a Baker Act. You need to ask a question. Why did they get Baker Acted? Was it a suicide attempt? Because an attempt is more critical than an ideation, or Baker Acted because they were out of control violently, okay? So you need to know, because Selena's gonna need to report an attempt and how serious the attempt was, so you're gonna have to get more information, okay? So, remember that. So if a parent calls you and said, my child's in the hospital, okay, that doesn't mean, oh, okay, let's, you need to find what hospital, why, what happened, because depending on how big of it is, depending on what happens, you don't ask the right questions, we might get an incident report that says the child's in the hospital, but then we're getting a call from somebody saying, this is what's going on. Pam or Clara or John's fielding it because it's gone that high up, and they don't have the information they need, okay? So it's critical that you ask them certain questions on those situations.
Oh, definitely, because a Baker Act, that's just a Baker Act because the kid is acting up, does not have to be moved forward. That gives you 12 hours, I just log it as internal information. A Baker Act, because of a suicide attempt, that has to go up the chain, and that means it has to be reported in 3 hours. So the more information you give me up front, the better. If you don't have the specific details, and we'll go over the form so you understand which details I'm referring to. You put in there, don't know at this time, waiting for a call from such and such, or I'm supposed to contact the parent such and such for additional information. Relay as much information as you can. That will prevent me from having to track you down to get the information before I report.
And I feel a lot more comfortable if it's one of those really major ones, saying that we're waiting for the parent or caregiver to call back in order to get some more information. We've attempted to call them, as opposed to,
I don't know.
Yeah.
Except the
I don't
Florida
like to
doesn't
say
like
I
that
don't
so
know.
much. The first section is the incident category. So to the best of your knowledge, pick what category this falls under. If you're not sure, there's an other, write it in and I'll figure it out. Date of incident, okay? This is the actual date the incident happened. Not when you found out, when the incident happened. So if it's something that parent calls you at 9 o'clock in the morning, last night at 10 o'clock, my kid went to the hospital. Well, it happened at 10 o'clock at night. So put that date and that time. The name of the client involved. Not the parent's name, not the sibling's name, the name of the client. The name of the victim if it's other than the client. So say a kid kicked the mother's in the shin and now she has a big bruise. Well, then you put the mother's name there. The location of where the incident happened. If it happened at home, put the family address down. Don't just put, here it just says family home, but it needs to be the address because it's something that I have to move forward on my other forms. If it happened at school, give me the name of the school. If you don't know the address, fine, get the name, I can Google. From whom did you find out and how? And it says including date and time of discovery. This is very, very important because this is when our countdown starts, is when you found out. And they're not always within 24 hours of each other. So on this one, the mother, Sally White, called the case manager on Tuesday at 9 a.m. to report the incident. And the incident had happened at 10 p.m. the night before. The case manager's telephone number, and this is also very important. What contract or program is this client being served under? Because then that tells me if it's an ADM, BNet, or successful students, it follows the state guidelines. I have to have it reported within 3 hours or 12 hours. If it is...
And we'll explain what all that.
Yeah,
Right.
you'll know.
If it's Magellan, there's other things that have to be done. If it's Healthy Start, they just need to let me know for internal purposes. They have their own incident reporting process for their contract. And each contract is a little bit different. Now, some of the people in this room was the Successful Families. Well, they had their own process too. They took care of that, but they still had to let me know for internal purposes. And then the date of admission to the program. The next section is participants and witnesses. I do need every column filled out to the best of your ability. It means birth date, especially for the client and the victim, I need their birth dates. And then description of incident. This is the who, what, when, where, why, and how. As much detail as you can possibly give me. Even if something has recently happened during like a home visit that might be insightful to the incident itself, I want it. Because if they ask me questions, then I'm prepared to answer questions.
And remember, if you weren't there, it's as reported to me by.
Right.
Okay, you can't say, this is what happened, this is what happened if you weren't there. If the mother's giving you the information, you need to put in the report.
The mother told me.
Mother reported, mother stated, mother told me, if it's the child telling you.
You don't want it to sound like it's firsthand.
Right. Because we'll come to you asking asking questions when really it's, you know.
Now, this additional information used to be up in the description of the incident, but I broke it out because you don't always think of reporting this information, but once again, it can be very important to how we proceed. And this is the types of services the client is receiving, the last day the client was seen, the mental status of the client the last time you saw them, medical concerns and diagnoses, psychiatric diagnoses, prescribed medications and dosages. Maybe this incident happened because their medication isn't quite right, you know? Is there substance abuse? Was there homicidal, suicidal, violent history? And any other miscellaneous comments or observations. Then there's individuals notified. Was the abuse registry called? If it was, when was the abuse registry called? And did you get a name and ID number? Or did the parent get a name and ID number? If the parent called, I still want the information. Or somebody else called. If a parent found out that somebody else called but they don't know any information, put down here, abuse called by such and such a person, information unknown. Just the fact that it was called. Was a doctor called? Put that down. Law enforcement, was a police officer called? Get the information the best you can. If you can't get personal ID information, at least get a date. And was the parent called? Did the situation happen at school? And school had to call the parent? When was the parent notified?
We're going away next month, you're not gonna see us, but the case manager doesn't see him till December, okay? And they say that at the end of after the last time you saw me, so-and-so was Baker acted. Do they still have to do an incident report? Is there a specific amount of time in between the time the incident happened and the time they were notified that they don't ever?
It depends on the incident.
Okay. So what would you want them to do?
Now with a Baker Act, call me.
Okay.
Call me, and we'll work it out. A Baker Act, depending on what the Baker Act was, and it's been 3 months, well, might just say, make sure it's in your progress notes. Make sure it's documented. Now, if it was Baker acted because the client tried to cut the wrists or do something crazy like that, let's get it processed, because if there turns out to be any complications down the line, we want it all on record.
So the bottom line is no matter how far along or how long it's been since the incident occurred, if we had it open, call Selena.
Yeah, even though child-on-child sex abuse is one of the super critical ones, we did have an incident 6 months or so ago where the case manager found out that this was a situation that happened 3 years ago in another state. We were told just to document because it was so far ago in a different state, and there was it was all kind of hearsay type of stuff. Central Florida told me just document.
In the event you get something like child on child or whatever, another mandated reporters, do we verify or see if it's already been reported so that it's not duplicated, or?
Put that, you know what, do the incident,
Right.
because once again, I'd rather err on the side of caution, and document that you're going to research
Call
whether
me.
this has already been.
Call me. Because the first thing I'd probably have you do if it was Hillsborough County, I'd have you call the abuse report and say, and the abuse hotline will tell you whether or not it's already been reported.
Yeah,
But I
because
think
we're
it's-
finding out new.
Yeah, and it's our information though,
Right.
when we find out, even if it's been done before.
Right.
You know, it's still important. I think,
And
for
it
us
would
to
be
go ahead
determine how we handled the situation on whether it was something that had already been addressed or not.
Right, right. I mean, like if the other providers were involved, i.e. the police or something like that, they typically call and notify CPI already, that's what I meant by right.
Documented in the description as well as your progress notes. That way, if I have to report it, it's
Right.
showing that action has already been taken.
And what's important with that is that Central Florida, who's the managing entity and all for DCF, they're paying us, not necessarily the school system or the police department.
Right.
They want us to be the ones to report. So it's always just better to err, as Selena says, err on the
They
side of
wanna
caution.
make sure that that client is being taken care of, regardless of who is doing it, just the fact it's happening.
Right.
And the more documentation we have, the better.
But I would like a phone call before you call the abuse hotline, because a lot of times we have therapists and other people that say, hey, the child told me this, you need to call it in. If you didn't hear it from the child yourself, it's not for you to call in because it's hearsay, they won't take the report. So if you have an abuse report, call me first, so we can talk about it before you actually do it.
If it's the therapist that was told, it's up to the therapist to call the abuse hotline or to call law enforcement, because they are the one that was told, not you.
Yeah, we therapists are notorious for trying to pan that
Yeah.
off to somebody else.
Nobody likes to call the abuse hotline. Nobody does.
No, it's not a good situation, but it's who finds out is who's really responsible for that. And as mental health professionals or doctors or any kind of professional, it's your responsibility to follow protocol.
Right.
So thanks a lot, and quite frankly, this is also a great clinical tool.
All right, so you can go ahead and flip it over and then go get your group.
What is it?
Wait, wait, wait.
This side, this side.
I
We
thought
might
you
as well
said,
just-
yeah, don't you mean like these four
Maybe we
and
should just
these
do-
five?
right, so that way
Yes,
we're aligned.
yeah, do
No,
it.
but that's fine with me.
All right, so
I'll
yeah,
go.
you guys, and
They're
you-
heavy loaded with people who've been through this.
They're all.
training.
And that's okay, they better be good.
They will be good.
They'll be at a higher standard, you guys will think outside the box.
Except for having braces.
Go ahead and sit where you're doing. If you wanna get out of the room, get out of the room.
Look at you, and there's plenty of room around everybody will be.
Look how I wrote them.
Just do the best you can, there's no grade, okay?
Just as similar.
I'm just saying.
And if
if
you
they're
miss
similar.
one and you say it again, we won't hurt you, I promise.
We may, but.
Kathy might.
They have new groceries, they have pets, they can provide for their pets. There's a phone, no evidence of bugs. There's toys present for stimulation. The electricity seems to be on. The family's intact. There's books and educational toys. There's pictures present, so they have pride and tradition. There's bottles, sandwiches, dishes, so they've recently eaten. There's clothes, means to keep warm from the heater, papers or some type of important documents on the refrigerator. They're cooking. They have nutritious food. The floor is relatively clean. Limited hazards, there's no like wires or anything exposed. They do the best with what they have. The water's working, they have curtains. They have a TV guide, so they're filtering what shows they watch. Educational toys. There's newspaper, ample amounts of dishes. The mom's smoking away from the child and close to the window. They have linens to cover the kids. They have some luxuries like a stereo. They have furniture. Dad has shoes. There's a washer. They recently went grocery shopping. Medicine present. Everyone looks clean. Children look happy and content. Well groomed. Mom's resting so she can continue to do her chores. Even though smoking might be a vice, at least they have money to buy cigarettes that aren't taking away from their basic needs. There's sensory props for the kids. Mom had coffee waiting for Dad when he arrived home. She cuts coupons to save money. She's supervising the kids. Has Max to wipe the shoes off by the front door so that there's cleanliness for the kids.
Yeah, that was a new one.
That was a new one.
The blinds are open to allow sunlight in. The cat can't walk on the counters.
That was a new one.
Both kids have on long sleeve clothes, so if it's cold, they have appropriate clothing. Mom has self-care and relaxation techniques. Because they live somewhere with nice weather. Mom shares. She has extra cigarettes down and the cat litter isn't smelly, so it's making the house smell good from the ammonia that was just put in.
You're good.
I don't have cats, I don't know.
And well, you shouldn't, you're pregnant, so you shouldn't be around them.
Right.
All right, well, good, we heard some new ideas, John and I did.
Yeah. What's also important to note as far as is the integration of Success for Kids and Families process with this too. This is actually also a team approach, because if it's successful students, Nancy, whom you met earlier, is actually already going to have started this whole ball rolling with this. She will have done our assessment, which is a multi-domain assessment. You'll get a lot more about that tomorrow. And she will have started the ball rolling. So you come in as the person that's going to be assigned to the family as a case manager, wraparound facilitator. Some of that work has already started. And so it's really important to make sure that you chat with Nancy about what the dynamics of the case is, read the assessment, and when you first meet with the family and Nancy, be ready to take off as to whatever point that they are. Because some families are going to be functioning well enough to where they actually may be through a lot of this stuff. Others, they might have just been able to say hi and give some information and that's it. So really, it's always individual. If you're taking a case that's one from one of our other programs or funding sources, the intake folks, and Colleen is one of them, will have already done a lot of this prep work too. They would have done the assessment. They will have started explaining what this is, the way of practice is. And so when you get the family, that already has started for you. So you may, most of the rest of the funding sources, it's like, all right, who else is going to be on the team and how can we enhance the safety plan? That kind of stuff. So bear in mind that even with this is a team approach.
Right. So like I said, you're going to want to talk to other team members about potential crises that they see that may be problematic for the family. And then sometimes, like I said, you're going to need to act immediately. You're not going to be able to wait to do that family support plan to intervene and get them the help that they need. Then you're going to talk to the family and the youth. You're going to look at the culture, their needs, their strengths. And you're going to work on a vision for them. What do they want to see when things get better? What will things be like when things get better? Help them think about that. Give them that hope. And then it says prepare a summary document, but we really don't have that, so you don't need to worry about that.
Yeah, don't tell the initiative.
Exactly. Yeah, we have to put that in there. But you're going to engage other team members as well, like we said. So.
Well, because we literally had just done the assessment.
Yeah. So.
And you're going to have your progress notes, obviously, to document the individual session progress stuff and all like that. So.
You'll also be making those meeting arrangements for the family support plan meeting. Where's it going to be? Is it going to be in the family's house? Are they comfortable with that? Is it going to be at the library? You really don't want it at McDonald's if you can help it, because you don't want everybody here in the family's business. But where can you have it? Can you bring them here to the conference room and utilize that if you need to be? Where is the family going to feel most comfortable? And where can as many people from the team come to that meeting? Maybe if the family's comfortable with the school, if you need that school teacher involved, maybe you're going to do it at the school.
No, a lot happens there.
If the family's not comfortable with the school and has issues with the school, you're probably not going to want to suggest that, so keep that in mind. But like I said, one of the first things you're going to do is work on developing their strengths, because that's one of the first key components of what you need to do before you do the family team meeting. We need to respect. I've changed that a million times. The wraparound process begins with respect. It's supposed to be for, and it's still far.
It's a go.
All right, so it begins with the respect for their strengths, culture, and choices. Strengths, culture, family talents, and preferences are the resources that families rely upon to meet their needs in their daily lives and within crisis situations. Most of the families don't think they have any strengths. They live in perpetual crises. they don't know why it happens, and they don't feel good about themselves. So it's our job to help build them up and give them the tools and help them see what strengths and things that they have. So, people practicing a strength-based philosophy don't ignore problems. They assess what the needs are behind the problems and focus on the strengths as pathways to solutions. So think about that. Like I said, we have issues as families. We have needs. But what strengths do I have as Beth Pecora that can help Caitlin get where she needs to be? You know, because I would have told you, I was a school teacher. They gave me the most difficult kids in the 2nd grade because I could deal with them, but I couldn't handle my own 2- and 3-year-old. I thought I couldn't do anything. So, and this is a quote that we have that John really likes too. It's the most natural way to facilitate a child's mental health and well-being is to identify the strengths and resources of a child, their family, school, and community, so that these strengths and resources can be coordinated to support the child's mental health and well-being. So as we've talked about today, bringing all that together and coordinating, and that's the role that you have. All right, so what is a strength? I think most of us know what that is, but a gift or talent or some quality that enhances our impact on our family and our community. All right, we all have them. Then there's resources, things out in the community that we can use to help us. And we're going to talk about strength, and then we're going to talk about resources and how you can bring all of those together. So, how do you identify and coordinate these things? Well, when you meet with your families, you've got to ask them who or what are the things that make it possible for your child to do these very important things. What do they need to make them experience satisfaction and happiness, to learn, to accomplish tasks, and to be connected to other people. Because if you think about the children that we're working with, a lot of them don't feel any of that stuff. They're not connected, they're not happy, they're not learning, and they don't get anything done. All right? So what do we need to do? What can we bring together in order for this to happen? This makes a child functional.
And actually, for me, this is a very important slide, or the content of this is a very important slide. Because if you look at this is a health model, and it's a well-being model. It's not a deficit-based model. You know, in medicine and mental health, we're always looking at what are the problem behaviors, what are the pathological behaviors that occur in an intense enough and a frequency enough level in order to be able to meet criteria for a diagnosis. And those things are very necessary because it's important in medical stuff to alleviate those symptoms. But this is a wellness model. And if you look at this, if you have a child, or yourself for that matter, and they're experiencing satisfaction and happiness, they're learning, they're accomplishing tasks, they're connected to other people, that's pretty much the epitome of functioning. And so what our jobs are is to help the families that we work with and the children and youth to get to this as much as is possible for themselves. And it's a paradigm change, because we're looking at improving life as opposed to decreasing certain behaviors and symptoms. Now, us licensed folks, you know, that have to do the diagnoses and have to write the treatment plans and all that kind of stuff, we're still going to deal with that kind of stuff. But hopefully what happens is in practice, that's what we're working towards. And when we get to the point where our society looks at these as opposed to the deficit stuff, that's when I get to retire.
All right. So we've done some research. If you'll see at the bottom, Chris Davis, John Mayo here. I don't know what Sicklin's first name is. Sicklin, what's her first name? Kathy. Martha Cobreeze and Noreen Dollar. Some of you know some of these folks. Did some research when we had the Think Grant, looking at what types of strengths are there out there. How can we put strengths into a language that we can all communicate with each other and then communicate with our families? Because, you know, you walk into the family's house or you talk to the child and you say, what are your strengths? Well, duh.
Yeah, right.
No. The kid might say, I play soccer real well, but, you know, there's other strengths besides sports. So this research helped them to identify 7 different categories of strengths that could be utilized to identify how a family does well or how a child functions well and how we can use those strengths in the family support planning process. So basically I'm going to use myself as the guinea pig and I'm going to go through this and kind of show you how we can do this. And be thinking about yourself, because in a minute we're going to ask you to do the same exact thing. We'll ask you to do it on paper, We'll give you paper to do it on too. And then we might ask you to share. So be thinking as I go through this and kind of use myself and John too as the guinea pig. Talent, strengths, or competencies. A lot of times you think of music and sports. Well, as an adult, one of my strengths and talent strengths is I'm very good at floral arranging. I don't know how, don't know why, but I'm good at doing that. So I can put together floral arrangements, make wreaths in my spare time, and I love to do that. How
We've
can that
never
help
seen
me?
any of that, by the way.
Yeah, right. If you come to my house, you've
Well,
seen it.
that's
They're all
good.
over
We have
my
seen- yes,
walls and
that's true. It
everywhere.
is.
So I did most of my own in my home, thank God. How would that help me? Well, when I stayed home with Katie for a while, one of the things I did was I did that and did craft shows and sold stuff and then went in people's homes and did that for a while. Resiliency strengths, the ability to survive in the face of chronic stressful situations, such as having a sense of humor, a strong spiritual or religious faith. Well, many of you that know me know within the last 2 years, my husband passed away. And so didn't think I had resiliency strengths. I really didn't. I survived Caitlin's stuff and I really thought about it. But when I lost James, I had to come to the fact that I could survive and get through all of this. But how did I do that? Besides my friends and my family, was my strong spiritual and religious faith. That really helped me to find my way and to get through all of that. But I never really thought of that at that time. I was just feeling yucky. But other people like John helped me to see that and helped remind me of that. Possibilities.
It's been a nice thing to, you talk about grief and significant thing, but at the same time, it's really been a nice process to observe and be part of.
Thank you very much. I think I'm coming out of the fog. The possibility strengths, goals or dreams set in the future towards which the family and team are working for.
This possibility strength is an important thing because basically that's what does it look like when it gets better? What is the family goal, major goal? That's what really this is. And sometimes we just see a goal as something that you gotta put on a piece of paper because of the fact that if you don't have a goal and it's not met, then you're gonna get dinged by some funder or some auditor or whatever like that. Or it's just something functional, it's like a widget. And it's not, it's what is possible for this family and this child and this youth. So it's something to actually be taken really seriously. And attainment of a goal and the possibility on is a strength.
And so for us, I would say when Katie was diagnosed at the age of 3 as a selective mute, my hopes and dreams crashed really fast. How was a child who was afraid of the world and wouldn't communicate, wouldn't talk, how is she going to go out there and achieve or do anything? How is she going to be successful? Our goal was to be able to get her into school and get her communicating. Well, we've been really blessed because our dream has come true. She made it to school. By the time she left the ELF program, she was talking to everybody and doing tours of the school as a 5-year-old. Think about what are the possibilities. Our kids can be anything they want to be if we can give them the tools and give the families the tools. So that was our possibility strength. Resource strengths. What is it about financial? These are strengths out in the community that you can get help with. For example, financial, time, knowledge, things that can help you. Well, the one thing I am really bad at is math and finances. And when James passed away and I had to deal with all that stuff and then invest and do whatever I had to do, I had no knowledge. Luckily, a wonderful gentleman by the name of David Tucker is now my financial consultant and works with me to help me be able to do that. So he's my resource in the community to help me with my finances and help me with everything that I need to do. So our families too have issues. Sometimes they're legal issues. Maybe there's a lawyer that they need because they can't get the birth certificate for the child that they've adopted. Maybe they are illegal immigrants at this point in time, but they have children that were born here. What do we need to do to get the family to be able to stay here? What are the resources in the community that you can pull together to help do with that? Borrowed strengths are strengths taken from an exemplary other person or the strengths of the intervention or treatment itself. And John gives the best one of these. Do you mind doing it?
So, Harriet, who is my oldest sister, actually was my oldest sister, she was an adult by the time I was born, and so she's actually almost like was more of an aunt than she was an older sister. When I was growing up, I used to spend summers, a couple of weeks there and stuff with her. Sometimes go down to Key West, spend a couple of weeks with my other sister Tish, that's still with us, and grew up really. So she was kind of like an extra parent, so to speak. And she died of very kind of long, drawn out, rather painful a set of afflictions and whatnot. But she, in every step of that way, was very assertive. You know, she would call myself and some of the other relatives and stuff, okay, I need to go to church this Sunday, I have the doctor's appointment on Tuesday, and I want to go out to eat at the restaurant Tuesday right after that. And she would let everybody know, give them almost always enough advance, and also that we would orchestrate things. And so I'd come down to Riverview, because she was living in Riverview, and had a job at the time that was kind of like what a lot of folks do. It was community-based only, and so I went out and saw the families, and also that was neat. I just orchestrate my caseload and all to be down in the southern part of the county, kind of like that area anyway. And she was very dignified. She was in a lot of pain, but she always pretty much, you know, she really didn't complain. She made things, and she made it easy for us to be able to help her and support her. And she died basically with lots and lots of dignity, with always basically a concern for the rest of the family, but at the same time making sure that things needed to get happen. And so if I've still got half a brain when I'm passing away, I want to die like Harriet, because it was really something that you could hold on to as far as a model is concerned. And not all of my relatives have done the same thing when they have been passing. And so I'm really kind of hoping that basically I can do that same thing that she did, because it was functional. She got stuff done, but at the same time, there was that love and really, quite frankly, respect. Very, very unique person. Taught me a lot about life.
So basically, what I found out in my family history, though, was that my great-grandmother, who suffered from major depression, 5 of her children ended up working in the mental health arena in South Carolina. One built the mental health hospital, one was a psychiatric nurse at the hospital, the other one, started the Mental Health Association there, and then, there was 4 of them. And then the other one would check himself in and out of the hospital when he needed it. So that was, I can't remember which uncle that was. But our family has a strength in mental health. So I utilize I have her thesis, her mental health thesis and all this stuff. I use that to help me forward my career in the mental health field, which then helps me provide for my children. Hidden strengths, those are strengths that are manifested on the surface through undesirable behaviors. A great way to think about this is through a gang leader. Very undesirable behavior, but they are leaders, they are good at finances, they are good at acquiring resources, you name it, they can do it. If I think for me, my hidden strength is I can kind of be somewhat bossy. So I learned to channel that into a different direction, to be assertive, to state what I need, but not to be so bossy like when I was much younger and just tell everybody what to do. I learned to be a little bit more diplomatic about it. So.
She really has to.
John's gonna be a long guy.
Yeah, because I've known her long enough to where that's the case.
So, what we want you to do now is to think about who you are, think about your strengths, and we want you to take this little worksheet, and we want you to think of 2 strengths in each category that you have.
At least.
At least. I usually say 1, then he says 2. Now I'm up to 2, he says at least. Okay. Because if you can't find your strengths, exactly, you can't help your families find their strengths. So we're going to practice this today, and then we're going to let you tell us all about you. All right. What about possibility strengths for yourself? What are your possibilities?
I can get my PhD up in my own business and move to Europe.
Ooh,
those are my I don't know what order that's all going to go in.
I like those, Allie. Good. All right. Other folks, possibility strengths.
Licensure.
Licensure, Lynn?
I think I'm visionary, so I see the big picture, and then I'm passionate, so.
Okay.
Good both.
So more traits as opposed to actual possibilities. So what would those traits end up being as far as the possibility of a goal?
I'm starting a business, and I've already made my business card. I'm just waiting for the paperwork to come in. So I see the possibility, even though I haven't made money.
So that possibility would be that
I see it.
That possibility of the business and stuff that you would do. Okay.
It's called the chosen treasure.
Oh, okay.
I like that. All right, what about resource strengths? What are some resource strengths that you might offer or bring to the table or that you've used?
Well, one I experienced recently was a strong work network. Helped me get the job that I have now. It's very connected to the church, supportive husband, and pretty big extended family that's there.
And you all actually are the resource strengths to our family.
That's what I was gonna say,
That's-
knowledgeable, that's one thing that I've gained through, through this position is increased knowledge of, community resources and counseling techniques, which helps me as a friend, as a parent at times, unless I'm told to stop therapizing people in my family, which happens on occasion.
Yeah.
You
That's
just
the I get
therapized
that all
me,
the
didn't
time.
you?
Yep.
What about borrowed strengths? Who's got a borrowed strength they don't mind sharing?
I chose how I would parent by modeling myself after my aunt, so that's a real borrowed strength.
That's a good example.
I put my father's creativity and focus on education. That's been a big one for me.
I'm not sure who coined the phrase, but I use the one that says your mind is your own limit. And the general who just died, Norman Schwarzkopf, who said to inspect what you expect. So those two I find pretty much work for me, because it gives me something to kind of like shoot at.
Okay, very good. What about past or historical strengths?
I borrowed one from my mother. She passed about 4 years ago, but I remember as a child growing up, no matter what the problem was, she always had a smile or, she was always smiling or laughing, which I guess her perception was not to let the family know, or not to let the kids know that there was a problem. Why she dealt with it, in her own way. And I kind of copied that myself, because I have friends who tell me sometimes they don't know whether I'm serious or I'm joking, which is good, because that's my mechanism that works for me.
Me being as analytical as I am, you can't say things and not be careful with the words you choose, because you may say something and mean it one way, but because of the way I analyze things, I'm gonna take it something totally different. You're gonna know how I take it, and it's gonna be up to you to correct it. But it can become frustrating, because it's like, why can't you I just said I'm going to the bathroom. All that other stuff, I'm using an example, but but I think that's a strength. People see that's weakness, but I don't.
Well, but that's actually a pretty good way of explaining part of this concept of a hidden strength. It's the strength that underlies is underlying in an undesirable or potentially undesirable or critical behavior, and it's an important, I think, skill that we need to have, because all of one member of the family or not that we're serving is going to have some level of an undesirable behavior. Otherwise, they wouldn't know us. And so just to look at what could possibly be the strength underneath that. And sometimes there are, and I would wager to say that there always are on some level. So.
Would trusting your gut be a hidden strength?
Yeah. Oh, but it also could be a resource. It could be borrowed. It could be a talent. And these things are interchangeable, so like I said, this is a work in progress. The reason why we really got frustrated, it's been a few years now, is we were frustrated because of the fact that our people, you all, were or what you will be for us, we're having this great difficulty being able to pull strengths out of the families and the children and youth that we were serving. So what could we do to help with a skill set to be able to make that easier? Or more productive, if nothing more. And that's how come this kind of, first of all, came about. And it was, because we wanted to be the best coaches and or supervisors as we could, and we realized that there was some new skill sets that needed to happen with this paradigm change as far as treatment is concerned with this well-being model. Because we were great at being able to look at the symptoms and frequency and the behaviors and my criteria for the DSM diagnosis. We did that in our sleep. But that wasn't what we were about. It was about this stuff.
Yeah, but please don't go into your family and say, let's talk about your strengths. What are your borrowed strengths? They're not going to have a clue what you're talking about. So, but as you're listening to them talk, you can identify those and say, hey, that's a strength and stuff like that. So.
Yeah, this is about you all in your mind when you're listening to the conversations that you have with your families, being able to assist, hopefully, in categorizing certain of these things so that you can feed that back to our families in the strengths discovery and the family support plan in working with them. And so it's really more of a set of things that are really more internal for you. So we've continued with this actually. Yes, ma'am.
I wanted to just say, I think sometimes that what we have as a hidden strength, or like my son, he was very bossy, but it was really that he could have chosen to be a leader,
Mhm.
but he ran from it. So it's like he had this skill that he was misusing.
That's very much a hidden type thing. Yeah. And we all have those things anyway. But like I said, we tried to continue with this, and Chris Davis is now at the University of North Carolina. And she and I have continued our association and relationship over the years. And we weren't real satisfied with just this, and so we decided to do some work to enhance this and to bring it to the next step. And we brought Beth into this, and actually an undergraduate intern from the University of Tampa. And so what we did was we recorded several family team meetings, then we transcribed those team meetings, and then we worked on a set of integrated reliability strategies with several of us, and went through those transcripts, identifying different types of strengths from the conversations in the family team meetings, which is one of the major tasks that you all are going to be doing. And for twofold reasons. One is to verify that these things really still were, these labels, these categories were still in the ballpark. And then we're also able to identify a few more types of strengths or categories. And also we're now at this point in time with some with basically some strategies that met the rigor of research and therefore could be peer reviewed. We've actually come up now with about 11. And we wrote that up and we just published it. And actually the publication is literally this month. And so this is the chapter, the new chapter that we finished writing. And it's for your reading. It may or may not help as far as those additional categories because they're kind of brand new and we're not sure exactly how to implement them. But it hopefully will help with one, a little bit more information that's up to date on some things. But the bottom line with this is we did this in order to instill hope into our families. And hope is a very critical part of this whole thing. And in essence, we may be calling ourselves system navigators, case managers, RAP facilitators, but actually what we really are and what we need to really remember is that we're peddlers of hope. And when families have hope, good things can happen. And so this is, like I said, it's kind of hot off the press basically. And it's part of a book on positive communication and health and wellness anyway. It'll be a university textbook and some other things. If you'd like to buy it, we really would appreciate that. And also, because we do get royalties. And those royalties for Beth and I would be put back into our agency, by the way, at least for another several years. And so, we also kind of like your feedback too, because these newer iterations of this to the point where there are 11 strengths, they're obviously just beginning, so they're not as valid as these things, because these have actually still continued with a fair amount of rigor in a couple of other studies. So it's kind of an extra thing to read.
All right, just to touch on a few things real quick, because we really want Kathy to be able to talk about family support planning. These are some of the other types of strengths that you might have seen: curiosity, athletic trainer, diligence, energy, compassion. Then let's talk a little bit about resources, because when you use resources, they can also help a child. For example, their video collection, or their pet snake, or their pet. We talked about canines, the Kids and Canines program. That's a resource that could be utilized in a family support plan to help a child. I think, was the pet snake yours?
Yeah.
Yeah.
John's always uses
and,
that.
or a part-time job. What can you help provide that child from the community that can help them?
It was Rex, the snake.
A family might have resources that are helpful, such as an apartment that meets the safety codes, you know, a car, extended family who can babysit, school strengths. These are real important because this is where the kids are most of the time. Teachers who really get to know their children and don't mind spending time with them. Philosophy of actively involving parents in teaching their children. Other resources, a well-stocked library, that one I've fixed 1,000 times too, and it doesn't want to stay. Yeah, it doesn't want to stay. Safe, well-lit, clean school grounds, bilingual classes, and a school counselor who can help children with various things. Then in the community, the other resources, neighborhood pride, outdoor play space, it's supposed to be a warm climate. All right, I'm not happy now.
She really has changed. I've seen the changes.
Anyway, other community resources, the public library, go to use the computers, transportation, which would be great out in Plant City, community mental health centers. Those are all different things that you could utilize, and we've done this as well. So now, I'm sorry to rush through that, but you guys kind of all know that stuff.
I do have a sample one for you. There is a case file sample on it. I am going to ask you not to look at your desk tonight, because tomorrow, you're gonna be coming up with your own family support plan, and I don't want you looking at my example and saying, oh, I can do this. We want you to be able to figure it out based on the information that you've gotten today.
And we have faith and trust in you.
Yeah, so if you look at it, I mean, the top, it's very basic, you know? The child's name's gonna go on there, though remember, it's a family support plan. But we have an identified child based on what our funding sources want us to do. But we also have overall family goal. So we could get a referral from the court system that they want something, you know, this child needs a psychiatric evaluation or whatever. We're gonna hang on to that, but we're gonna bring that to the family. And we're gonna ask the family, what is their overall goal? Now, we're gonna remind them as we talk about it that the courts would like you to do something. Now, there could be a family that could say, you know what, we are totally against psychiatric help, we do not want it. Then it's our job to help advocate for the family and help them advocate for themselves to find an alternative services that's gonna meet the court's needs and their needs, okay? But it's gonna be an overall family goal. It's gonna be what they identify as the goal. And the completion plan, what's it gonna look like when it's over? We want the families to tell us. What's it gonna look like so you guys can get out of our life? We want them to let us know that. The key is going to be, the completion plan is when, not what it looks like to us, because we all know what we want our families to look like when they're better. They're gonna look like us, right? Now what's gonna happen? Most of the time, a lot of times we go into families thinking we're gonna leave with them looking like us. It's gotta look like what they want and what they're asking for. Sometimes we leave and that's what they want, and they call us 5 months later, because now they wanna take it up a step. They're there, but now they wanna go somewhere else. So, that's gonna be the completion plan on the family support plan. Meeting attended by. When you get into doing your family team meetings, the family gets to identify who's gonna be in that meeting. You're gonna, it's hard to talk when, you know, you do your strengths assessment that we've talked about. You're gonna do an ecogram, which the ecogram helps the family identify their formal and informal supports. Those two things are gonna help you and the family identify who they wanna be involved in doing their family team meeting. Every piece of paperwork that you're gonna have in this file is gonna help you complete this. It's all a circle, okay? Everything is a circle. If by chance you have a piece of paper and you're trying to do your family support plan and it's just not clicking, it just means that you've gotten off track somewhere, okay? Everything that you do, everything that we've talked about all day today is gonna connect to something else within this family and within this child, okay? Usually the first family support plan and team meeting, usually it's just family members, maybe an extended family member. By the next time you do one, there should be more informal supports and formal supports added, okay, for the family, so they know who to go to when we step out. Domains, if you notice, we have 10 domains, okay?
these are the areas we're gonna touch base with the family to find out, what's going on with them. Okay, you can actually give them a copy of this. When you're doing and they'll do it when they do the family team meeting. They can have a copy of this. You're gonna talk to the family and come up with what some of the goals are and objectives before you actually do the family team meeting, because you wanna go in with an agenda and with things, and again, we're gonna go over that. But on the family support plan, you have 10 domains, you're gonna go through them all with the family. Every domain, whether there's a goal or not, is going to have a strength.
Everything. As a family member, I have responsibilities as well, and so should the youth. And maybe even the informal supports if there are any involved in the family, so keep that in mind too.
And it may be that in this safety plan, the case manager, rep facilitator, the need might be to get Sally to a therapist on a regular basis. The therapist will have the treatment plan that's actually going to be targeted toward decreasing suicidal behaviors and increasing more productive behaviors. And so the actual need might be transportation, might be support. And so this is also a really important thing, especially for you folks that have been trained as master's level social workers and want to be therapists, mental health counselors, marriage and family therapists, is that you can step out of what that normal therapeutic domain is, because it may be that that's really what's necessary, is to get this family to services that are going to help decrease whatever the safety behaviors is, or get the services to them. And that might be part of that. Might not, it depends. But it's important, I think, for us to kind of know that all those options and all are open, because the goal is for the kid to be safe.
Now, and as Beth said, people are responsible. Now, you also have to know your population, know your family, okay? Maybe you have a parent who is from another country, doesn't have a phone, has never used a phone before. So, you may be responsible for assisting or being the liaison with the parent regarding how to make phone calls, you know? And when you revise this, maybe mom, that's something that's mom done, and you're gonna say, you know what, you did a great job, you made 3 phone calls this week, or this month, you know? So that may be, it may be as simple as that. Or it may be to the point where you're gonna link mom, you're gonna give mom a list of therapists, and mom's gonna call and set appointments to interview them. Sometimes, I've done that with children. They're 17 years old, 16 or 17. I have some teenage girls that say, I'm not talking to anyone. I say, okay, I tell you what, how about we give you some names, and we invite them over and you decide whether you want them there. When you include them in the process, sometimes they'll do it. So you're gonna be maybe the liaison. You're gonna be maybe the link, you know? We are teaching. We want to leave this family with skills that they're gonna be able to take care of themselves when we walk out. This is what the family support plan is going to do for them. They're going to get a copy. They're going to get to keep this. We teach them. They may even use it when we leave. They may use it and say, you know what, under education, you know what, Sammy, you're going to go to school every day. And he's like, oh, okay, well, what are you going to do? How are you going to get to school every day? And the parents usually say, you know what, we got you that brand new bike. We're going to let you ride your bike to school every day now that you're 15 years old. And the kid's like, okay, I get to ride my bike every day. So they can use this. This is a tool that if we teach them and show them how to use it, they can use it.
How often do you do revise family support plans?
Every 90 days. That's the maximum. That's the minimum, isn't every 90 days. I like, what I tell people to do, and I know it's a lot of work, if you get your first one done, everybody signs it, and then you go put it in your computer. I say every time, once a month, you go see the family, you bring it, and you talk to them. And you say, hey, so what did you accomplish? If you wait for every 90 days, then the family's not, you know, either you have a family that, you know, say goal 2 is emotional behavioral. And so one of their goals is to get a therapist in the home, so you say to, you know, Sally's mother, here are 4 names that take your insurance. Here's the phone numbers, I want you to call them. Target date is 2 months away. If you wait for 2 months, maybe she's never done it. And then when you go talk about it, she's like, oh, I forgot the names, I don't know where I put that piece of paper. If you go back the next time and you say, hey, how you doing with those phone numbers? She said, I only called 1. Good job, you called 1. What did she say? What did he say? you have a chance to get some successes and to remind them to keep it going. You keep them focused. I say there are 2 pieces of paper, 2 documents that every time, at least once a month when you go visit, that you need to review with the family. One is the safety plan, and the other is the family support plan.
And what's very interesting in our system these days is the disconnect between different funding sources and also evidence-based practices. If we're doing, if like with Successful Families, we're doing high quality wraparound, the National Wraparound Initiative says it's not wraparound unless we're having family team meetings every 25 to 35 days.
Can these be typed or are they always handwritten?
No, actually, we prefer it typed because we can read it, but what I tell people is when you go out and do your first one, because remember, you're always kind of like a month behind, so if you go out and you go see your family tomorrow, and you set up your first family team meeting is gonna be 3 weeks from now. And then you sit down and, you sit with your family and you identify some of the goals, some of the things you wanna address when you have your family team meeting. When you finally have your family team meeting and you have everyone there and you decide who's gonna do their goals and who's gonna do what, and you go home and type it all up, then you have to go back and get everybody who was there to sign it, which could take another extra month. What I try to say is if you can handwrite it while you're there, putting all the information that's legible, you can have everybody sign it. You can type it up later, have a typed copy in the computer, okay? So your second one, you just print out copies for everyone that's gonna be at the next family team meeting. Everybody gets a copy. If there's any revisions you need to do, you can do the revisions, but you can do the revisions, everyone can initial it and sign it. And then you have it up to date, okay? With the Successful Family or Successful Students one, it's a little easier because you have more hours, you have more case management hours, so you can actually, go out and get all that done. So, that's what I recommend. Okay, so that's page 1 of the Family Support Plan. We'll move on to page 2, which has 4 more domains on it that you're gonna address with the family. We're gonna make sure we put next scheduled meeting on there, which is in 90 days. It's not gonna be the next time that you meet with the family. It's gonna be the next time that you're actually gonna meet with the team to complete a brand new family support plan. Everybody signs it. If you have a child that's too young to sign it and not able to sign it, you're gonna make sure there's something here that says too young to sign. Though, we really recommend and we ask you to have everybody sign it. If the child's young, give them a crayon, give them something, make sure it gets completed. We wanna also make sure that the family checks off whether they agree or disagree with it. Okay, that's important. Hopefully though, when you're doing a family support plan, they've made it so they're gonna agree with it. And you wanna make sure they check off that they received the copy. Okay, and then once everybody signs it, you're gonna make sure they all get copies of it signed, and the original is gonna go into the chart.
So now we're going to move into phase 2, which is the initial plan development. During this phase, team trust, mutual respect are built while the team creates this initial plan. And Kathy really went over that initial plan and stuff just before. I think what's important with that is that for a high quality wraparound, those plans are updated as is needed. And so while the outside limit is 90 days, it's basically directed by our funders. With high quality wraparound and Successful Students in particular, teams are going to be able to be meeting and need to be meeting 25 to 35 days at a time. And so you're going to see the review dates change with that specific population also. But make sure that it's a quality process that reflects those wraparound principles that we talked about earlier. So in initial plan development, you want to determine ground rules, describe and document strength, create the team mission, or what is it going to look like when it's better? And that's a work in progress. That may look somewhat different as time goes on and family team meetings progress. Describe and prioritize needs and goals. Determine the goals associated with the outcomes and an indicator for each goal. In other words, what does it look like when it's done? That could be a time frame, like this will be completed by June 1st. It could be something on the lines of when something is finally here, like actually getting food stamps. Select strategies and assign action steps. And those action steps, and we've said this before and we'll say it again, those action steps need to be done by everybody, not just the facilitator or the case manager. You're going to develop a crisis and safety plan. during our assessment, that process has already started. So once you get an assigned case, most of which those safety plans have already started, and so you're going to be continuing with them. There are going to be certain families, though, that all of a sudden have safety issues that may not have been known or documented before. So determine potential serious risks, create that plan, and we'll go over that in another section later on. Complete the necessary documentation and logistics, and those are a combination of what wraparound requires, but also our funders and some things that Success for Kids and Family requires. So what is the Family Support Plan? It's participant or family-centered, created and written in partnership with the facilitator and the team. It's a planning process or a roadmap for participation with the family. So it's not a set of services, it's a process and a roadmap. It's a guide to services provided by the team and the facilitator, and it's to document and basically how identified concerns and priorities, resources, how they're being addressed to be able to really help that overall mission, which is what is it going to look like when it's better and how a family can function better. The Family Support Plan is essential because it increases families' use of strengths and supports, referrals, risk factors, all those other kinds of things. How can those supports and referrals reflect what their needs are, but also integrate their strengths? It aids in problem-solving skills, increasing the chance for success, and it models the importance of planning, which is characteristic of a healthy family. It provides a record of success, which again is also a characteristic of a healthy family. Teaches families to set goals and how to achieve them, and it guides the RAP facilitator and the team on areas the family is willing to work on. It enables and empowers family. It helps families acquire a sense of control. It strengthens families in their natural supports. It helps families to acquire competencies. And most important, it basically gives hope to families. And we're peddlers of hope. That's our main real job when all this stuff really gets down to it, is that if we can instill hope into a family and get that to a point where that's something that's new in their everyday lives, then good things are going to happen to them. So, family team. It's chosen by the family to create a family support plan. They may invite formal supports, such as therapists, tutors, those types of things, but also informal folks, such as friends, relatives, religious leaders. They choose which formal supports they want at the meeting. Formal supports can include case managers, school personnel, etc. So let's get started. So convening a family team, in other words, to create a family support plan. Meet with the family to choose the team members. So this is done beforehand. And that's what I talked about earlier, the fact that there's a lot of activities that lead up to actually having a family support plan. The family should select all of the team members. They include family, friends, neighbors, providers, therapists, those kinds of things. With a lot of our programs and a lot of the ways that families come to us, there are folks that are mandated to be working with the family, such as a family coming from court. They may be in child welfare or juvenile justice. But the family still needs to pick who's going to be on the team and when those things are going to be addressed. So remember, family support team is not just a child and family case manager. The team meetings must include input from the entire team, either by attendance at the meeting or by speaking with the team member prior to the meeting, and share the information basically so it can be included in the plan. So there may be a team member that for whatever reason just cannot be there. This often actually happens with psychiatrists and medical doctors. Get that information and have them have the family support person or the team member or a family bring that information to the team. So you need to revise and do a family support plan within 30 days of receiving a case. And again, the outside limit, based on our funder, is to change it every 90 days and update it then. But again, it needs to be updated whenever there is a need in order to be able to change the plan. It's very important. So facilitating a family team. So prior to the meeting, call the team members and remind them of the meeting, the location. Collect information from those team members that can attend, as we talked about earlier. Gather supplies such as chart papers, markers, those kinds of things. Create a list of strengths for each family member and do this with the family and create an agenda. This is a rather long list of things that really happen within a family team meeting. It's important to have an agenda, set a time limit. We usually like to really have team meetings last an hour, maybe an hour, 15 minutes. Set meeting ground rules, and we'll go over them, some suggested ground rules in a little bit. Make sure you introduce and have everybody introduce themselves at the beginning of the meeting. Structure the meeting so that basically you're working towards an outcome, a product of actionable types of things. Review the goals, objectives, interventions, and or progress if you've already had team meetings that have happened already with the family. Make sure that the strengths of the family are discussed and the needs. Discuss the goals, especially and the domains that the family has agreed that they want to deal with at that meeting. Share information with from those who couldn't attend. Decide the action steps to how to reach those goals. Assign who's responsible. Review the plan. Always schedule the next team meeting, even if there is some confusion about or uncertainty about whether that actual date can happen. Schedule it anyway because it can always be changed. And then adjourn. Now this is a list basically that kind of summarizes that slide before. It's about ground rules, strengths, needs, goals, action steps, assignments, review, and adjourn. It's kind of like the overall summarized process of a family team meeting. So ground rules. Focus on the strengths, advise parents ahead of time, have a few of your own members too, which is really important. And have a few for your own members. The goals are based on the child's and family's needs and strengths. Everyone is expected to contribute. The family, child, and child has equal voice. And equal voice is not, well, Mrs. Smith, you certainly agree to all this stuff, don't you? That's not equal voice, not by any means. Please avoid side conversations, avoid talking over each other, and make decisions. Make sure that after an hour to an hour and 15 minutes that the family, the team, has actually had a productive, worthwhile experience. But what we'll do tomorrow is some of that stuff really, there's sample agendas, there's all kinds of things that we give you. Besides, you've got all that history.
No, I don't.